on. Test. Yeah.
Test. Yes. Good morning.
Good morning, everyone. Just have a seat so we can start. We can proceed.
Okay.
Okay. Rise and shine, dear nurses. Welcome to the second day of our first International Nursing Conference in Al-Ahsa. I really hope that you were all inspired, empowered by the amazing sessions we had yesterday. I hope you were really empowered by our nursing excellence, nursing leadership, by our superhero leaders that we invited yesterday.
So,
You can.
okay.
Today is very unique, very special to all those excellent nurses, outstanding nurses who were eagerly waiting and eagerly deserve to be recognized by Daisy Award.
So today, let's begin first by taking a moment to spot the light on an organization, a unique organization. It's like a platform for the nurses to be recognized for their hard job and hard work, the Daisy Foundation. And I want to thank you for this because you made our nursing world look like an Oscars, and we all are waiting to get awarded and to take the award. So thank you, and we are very honored as Almoosa Group to partner with you. Thank you so much.
It's our pleasure to invite to the stage our role model in nursing, Dr. Bonnie Barnes.
Good morning. What a thrill to be here, and thank you for that beautiful introduction. When I hear someone call me Dr. Bonnie Barnes, I have to smile when I'm among so many real doctors who have earned the right to be called doctor. I am an honorary doctor, but I'm grateful for that recognition, so thank you for that. Now, let's make sure we can get this to work. You ready? There we go. Good morning. So it's a thrill for us, for Mark and me, to be with all of you, to celebrate everything you all do every day that makes such an extraordinary difference in the lives of your patients and your families. And we always start our presentations with telling you why we are so passionate about the work that nurses do. So I want to make sure you are introduced to our family. This is Patrick Barnes. He was Mark's son, my stepson, who at the very end of 1999 woke up one morning with some strange symptoms. He and his wife had just given us our first grandchild 6 weeks before that particular morning, and he was concerned, and he went to the doctor and found out that he had a dangerously low platelet count. So very quickly he was admitted to the hospital. Well, when Mark and I heard that he was in the hospital, we flew to his hometown to be with him, thinking that he would be there for a few days, having been diagnosed with a thing we had never heard of, called ITP. It's an autoimmune disease in which his his body was creating antibodies that were destroying his platelets, so he was bleeding internally. So we went there. We thought we'd be there for a couple of days, and then he'd come home and get back to his life, and we'd go back to our home and get back to doing what we were doing before he got sick. But that's not what happened. Patrick got really sick in the hospital, and Mark and I, rather than staying with his wife and the baby, ended up moving into the hospital to be by his side pretty much day and night to help him and to understand what he was going through. And at the end of what were truly the worst 8 weeks of our lives, Patrick died. Well, I know you as nurses have been around families like ours for years. And, you go on this emotional roller coaster, and suddenly it was over. Now what do we do? Well, right after he died, we got together with his wife, Tina, who you see in the picture, and baby Riley, our granddaughter, was swinging at the end of the table at a restaurant where we were starting to talk about what could we do to fill that gaping hole in our hearts that Patrick's death had caused. What could we do to turn our attention back to something positive because he was such a positive person? And what could we do to get through this incredibly emotional experience? Could we think of something out of those 8 weeks that could help us cope? Well, the only thing we could think of that was positive about those 8 weeks was Patrick's nurses. We had expected they would be excellent from a clinical perspective, and they were. He had a very complex condition, and all of this technology was being connected to him to try to help overcome his very serious case of ITP. But what really impressed us was not how good they were clinically. As I said, we expected it, but it was how they delivered their care. Patrick's nurses were incredibly compassionate and thoughtful and sensitive, not only to him, but to all of us in our family. So when he died, we realized that what we really needed to do was to express the incredible gratitude we felt to Patrick's nurses. So how would we do that? Well, over dinner that night, we created the Daisy Foundation. Come on, clicker. Okay, clicker. Next slide, please. There we go. And as I hope you know, DAISY actually stands for Diseases Attacking the Immune System, and our concept was to create a way for patients and families and coworkers to say thank you to nurses by sharing their stories of extraordinary, compassionate care and nominating them for this thing we called the DAISY Award for Extraordinary Nurses. So it was a very simple concept. Patients and families would write a nomination for the DAISY Award, and in hospitals or whoever we were partnering with, they would have a committee of nurses who would choose a nurse each month to be honored with this program. Well, we thought that if we could say thank you to nurses in maybe 10 hospitals around the United States, we would feel better, and we could go back to doing what we were doing. But that's not what happened. Nurses and nurse leaders like your Miss Hera and so many others got a hold of this concept of the DAISY Foundation and the DAISY Award. And so today, next slide, please. Next slide, please. There we go. Today, we are, 23 years later, honoring nurses in 34 countries around the world. Over 5,600 healthcare facilities and schools of nursing right across the continuum of care are committed to honoring nurses month in and month out with this recognition program that celebrates extraordinary compassionate care not only on International Nurses Day or in our country National Nurses Week, but every week, every month of the year. Over 200,000 nurses have been honored so far. But the number that means the most to us is the fact that more than 2.5 million times a patient or a family member or a colleague have stopped and taken the time to share their story of what a nurse has done that's truly made a difference in a patient or a family's care. So more than 2.5 million times tells us we are not the only people who need to say thank you to all of you. And when I read through nomination stories, and Mark and I read them, thousands of them, because they are so fulfilling, what do they say? They tell stories of how nurses have done what they've done, not just what they've done, but how they've done it. And how they've done it, how you all as nurses have taken care of your patients, makes your patients feel safe, they feel cared for, they are filled, these nominations are filled with emotion. And there's a famous quote from a famous American poet named Dr. Maya Angelou, who said something that we know is so true. I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel. And that's how we as patients and families feel about you nurses. It's how you make us feel that makes us filled with gratitude to you. Well, you can only imagine, next slide please. You can only imagine what all of this has done for our family. I mean, to see Daisy come to life around the world and being embraced by so many nurses and nurse leaders who have seen its strategic value in uplifting the nursing profession, that when you shine a light on all the right, what can happen to a culture of an organization is just astounding. You know, we learned early on that you as nurses are trained and educated to focus on what's wrong. What's wrong with this patient? What's wrong with this monitor? What's wrong with the parking lot? I mean, there's always something wrong that you are having to fix. But when we focus on what's right, when you celebrate the extraordinary care that you're providing every day, it makes an amazing difference in culture. And we are incredibly proud of the fact that we get to see around the world what the Daisy Award is doing for nurses at places like Almoosa Specialist Hospital. To experience the joy that you all are getting out of our program, well, all I can say is that gaping hole in our hearts has been filled with our gratitude to nurses. Could you click the next slide, please? There we go. So when we say thank you to nurses, there's pretty much one thing we hear back all the time. Thank you for reminding me why I became a nurse. What the Daisy Award does, as we understand it, is to bring all of you back to the reason you became a nurse to begin with, to take care of patients and family members with compassion, with your hearts, with your brains, with your hands, and with your commitment. Now, there's been an awful lot of work done in the last several years on what meaningful recognition like the Daisy Award is actually about. Oops, let's go back one. So, meaningful recognition. Well, what is meaningful recognition? I think it's recognition on steroids, but I'm not a nurse and I'm not a researcher. But there are a lot of nurse researchers who have looked hard at what meaningful recognition actually means. And as they've studied it, it comes back to this very simple definition. Meaningful recognition is positive feedback that is telling a specific experience that a nurse has had on a patient or a family member or a colleague. Can you click for me, please, one more? And that specific feedback is providing a statement of the impact you have had on other people. And very importantly, this kind of meaningful recognition has a long-lasting effect. We know that we as patients and families never forget extraordinary nurses who take care of us, but we also know that when you are thanked, when you feel the gratitude of your patients and their family members, that it has a long-lasting effect on you. And hopefully that those nomination stories you are receiving, whether you're chosen to be honored with the Daisy Award or you're receiving your nomination, doesn't matter. You're getting the feedback of your patients and families that's so incredibly positive. So we've spent a lot of time looking at what is the impact of the DAISY Award, and we know that meaningful recognition is one of the 6 elements of a healthy work environment. All 6 of those elements need to be in place, things like authentic communication and skilled leadership, and there's a whole list of the other 5. But when you have all 6 of those elements in place, including meaningful recognition, it contributes to a culture of gratitude and trust. Very importantly, as I said before, meaningful recognition ties you back to your purpose, especially because it comes from the people who matter most to you, your patients, your families, and your peers. And our research has indicated that recognition can help to buffer the negative effects of burnout. And boy, has that been important over the last few years. A study we did a few years ago showed that those nurses who had been nominated for the DAISY Award and received a copy of that beautiful statement of gratitude from patients and families had lower compassion fatigue, lower levels of burnout, and they had higher levels of what the researchers call compassion satisfaction, the self-understanding that you've done a job well, that you've made a difference in someone's life. And for patients and family members who have had the opportunity to say thank you to you, well, we know this from our experience. Nominating a nurse is really a kind of therapeutic reflection. It facilitates healing, it strengthens a connection to the organization that has given you the opportunity to say thank you. I can tell you that at the hospital that took care of Patrick for the last few weeks of his life, I am on every DAISY Award presentation via Zoom because of my relationship with that hospital. I will never, ever forget what they did for us, and I want to be there for their nurses. Well, the DAISY Foundation and the DAISY Award has really evolved, and it is now our sincere mission to honor nurses wherever you practice and wherever you are in your careers. So while we started with the DAISY Award for direct care nurses, we've created other applications of our program, and I hope that over time Almoosa will adopt all of these. But for example, we're now honoring nurse-led teams. Click. Can you click again, please? Nurse-led teams. We know that one nurse may be your primary nurse, but it takes a team to provide extraordinary care, doesn't it? And as Mark often says, there's no team sport like nursing. You all know how to work together like no one else, and we certainly see that and felt it when we visited Almoosa the other day. So we have a way to recognize nurse-led teams. We also have come to understand the very important role that nurse leaders play in creating an environment where all this extraordinary compassion is going on for patients and families. And we listen to nurses describe what their managers mean to them, what their directors mean to them, what their chief nursing officers mean to them. So we created a DAISY Nurse Leader Award, and this past year we've done a whole campaign that's been a tribute to nurse managers. We call it Beyond Gratitude, as a way to say thank you to managers for everything that they do in upholding nursing care. We have a program to recognize nursing faculty, where we partner with schools of nursing to give students a chance to express their gratitude to the faculty members who have inspired them to become the nurses who will receive the DAISY Award for their extraordinary care in the future. And these faculty members are so touched by getting the feedback from their students as to what their work has meant as teachers. Not just the kind of academic research they're accustomed to receiving as researchers and presenters, but as teachers, which in many cases is why they came into nursing faculty. And at the same time, we created the DAISY application for nursing students who are providing extraordinary, compassionate care when they're doing their clinical rotations. We created a Lifetime Achievement Award as well for those nurses who have dedicated decades of their lives to providing extraordinary care, to mentoring nurses, to providing leadership, and who have, usually they're on the verge of retirement, and their teams want to let them know what an incredible difference their entire career in nursing has meant. So the DAISY Award is now honoring nurses wherever you practice, wherever you are in your careers. Now, I want to turn this presentation over to the love of my life and the man that all of us at Daisy know is the true guiding light of this mission of gratitude and recognition that we have for you. I want you to meet my husband, Mark.
She's always kind of a hard act to follow, but some of you may have heard our speech a month or so ago in Jeddah, in which I said that when we first started talking together, Bonnie would have about this much to speak, and I'd have about this much to speak. And over the years, Bonnie's has gone over about here, and mine has gone over to about here. And I said at that time that that was probably going to be, okay, that was probably going to be my last speech, but she relented, and I have now got an opportunity to talk to you again. And the first thing I want to say is, being a lot older and wiser, I agree with everything that Bonnie says. I have found that it makes life a lot easier to do that. But today what I'd like to do is talk about the word heroes. There's been a lot of talk back and forth about nurses being heroes. And I think we have to define what heroes means, because some of the nurses push back to that and they say they can't do the impossible. But I'm not talking about the Superman or the Wonder Woman or the Captain Marvel. I'm talking about the heart and soul of everyday heroes. And that's what nurses are. And I have proof. It's maybe not scientific, but it is close enough for me. And that is that several years ago, probably about 15 years ago now, Bonnie and I had the opportunity to make a presentation at Walter Reed Military Hospital. And for those that aren't familiar with it, that is America's largest military hospital. And we had an opportunity to talk with the commander of the base prior to that presentation. And I asked the admiral, why do nurses always say, I didn't do anything special, I'm just doing my job? And without any hesitation at all, this lifelong military man said, that's because nurses are heroes. And he said, our Medal of Honor winners, which is the highest award that a military man can have in the States, our Medal of Honor winners and our nurses are America's heroes. And that made a huge, huge impression on me, that this military man said nurses are America's heroes. And I think if he'd been exposed to nurses around the world, he would have said the same thing. But as I said, that impressed me a great deal. But what impressed us even more was during the ceremony itself, the soldier who nominated his nurse read this beautiful nomination. And when he was all done, he looked up at his nurse and he said, "You're my hero. You are my hero," from this military man. So in conclusion, I would just like to give you a few examples, and I've written them down so I won't forget them, of what I think heroes are. And I want to thank you for tolerating me to express my thank yous to the nurse who went to the grocery store to buy that special flavor of ice cream for the little boy with no appetite and a craving for a special treat. Thank you. Thank you for washing the hair of the teenage girl who wants to look nice when her friends come to visit. Thank you for sending the cancer-stricken patient home with a smile and the courage to fight this terrible disease. Thank you for staying past your shift and being there when no one else could, because you know that no one should ever die alone. Thank you for working with transport to get the patient up to the roof so he could see his beloved city one more time. Thank you for making sure that Blanky and his favorite toy are in the recovery room when your very young patient comes down from surgery. Thank you for making arrangements to bring the patient's pet into his room so he could say goodbye to his friend of 11 years. Thank you for going through the garbage in the basement to find the priceless treasure of your elderly patient that housekeeping had thrown away because they thought it was trash. And thank you for sitting with a middle-aged man who had had so many surgeries and he just wanted to pass and get it over with. He'd had a good life, he was at peace with the world, but his nurse wouldn't let him. She'd come in, she'd hold his hand, she'd talk to him about his children, she'd talk to him about anything. She'd talk to him, she'd tell him jokes, and on and on. Every time she went past his room, she'd wave, she'd smile. And he nominated her and said, "I'm alive today because of her. She gave me the will to live." So those are the stories who I think are everyday heroes. Those are why I think nurses are heroes, and I will defy anybody to tell their patients that they weren't. And I want to close with a couple of personal thank yous. Thank you to the night nurse for sitting with our son Pat when he couldn't sleep and playing sports trivia with him. Thank you for explaining what the doctor said, and we kept asking the same questions over and over. Thank you for being there to explain that. And even though he didn't eat very much, thank you for decorating his room and fixing his favorite dinner so that he and his wife could have an anniversary dinner together. And most of all, thank you to the nurse who, when Pat passed, was there. Thank you. Thank you very much.
I'm a bit on tears as well. Thank you so much for your heart-lifting and inspirational words. And I can clearly see that the love between us and the gratitude for you both is reflected in Daisy, even not only in the nursing profession, but even between us. So by Daisy, you are giving us the love, the pure love, the gratitude, the passion to continue to give to our patients the best care and to receive this smile at the end of the day from him. And to thank you for making me feel I'm a better person now. So thank you so much, and I'm so proud to be a Daisy nominee. And now, our special stories will continue to raise up our heartbeats, and we'll now listen to a very, very special story happened in our hospital, who reflected the pure value of nursing and the passion and the compassion between the nurse and the patient. So, Mrs. Lori Joy, please join me to the stage.
Good morning, everyone. I am Lori, and I'm going to tell you a story about Ala. Ala was so young when she was admitted to the long-term care unit of Almoosa Specialist Hospital. She has been born with a disorder that affected her growth and development. Despite her condition, she was cheerful, curious, and always eager to learn and explore the world around her. I'm her nurse for years, and from that moment I met her, I knew I was meant to take care of her. Ala's spirit and resilience deeply moved me, and I quickly became her closest friend and a confidant. Despite Ala's challenges, she never lost her sense of wonder and joy. She learned to speak English, Filipino, Urdu, and different dialects of Arabic. She wanted to communicate with the nurses in their language to tell us about her dreams and aspirations. I never thought of myself as just a nurse, period. The nurse's role is way bigger than the care spectrum. With a longing to see Allah's spirit flourish, we dared to defy the odds stacked against her. We requested a personal tutor to teach her how to hold a pen, how to draw, and paint in different colors. We also celebrated her beautiful existence with joyful birthday gatherings. One day, as the sun began to dip below the horizon, we wanted to give Allah a sense of awe and wonder. We gave her the opportunity to witness the sunset for the very first time in years. Tears welled up in her eyes as she watched the fiery orb slowly disappearing below the horizon. Allah felt a warmth in her chest as she took in the beauty of the moment. And I couldn't be happier with this simple gesture. I gave Allah what I think is just as important as medical care. I gave her my time, a kind, compassionate ear, knowing how much Allah needs to be heard. My bond with her was one of the most beautiful things I had ever experienced in my entire life. It was a reminder that even in the most challenging circumstances, there is always hope. And the love and care of someone like a nurse can make all the difference. So, shout out to all the nurses here and all over the globe who practices autonomy, who educates, who lends a listening ear, a comforting touch, and a kind word to those in their care, to those who connects. We all are unsung heroes of the healthcare system. We all have someone like Allah and Patrick to give our utmost compassionate care. And mind you guys, we all are doing that well. Thank you. And now, I'm going to leave you with the documentation of our precious moments with Allah.
ولدت آلاء بمتلازمة هيدروسوفلس، وهو تراكم السائل النخاعي في بطينات الدماغ والتسبب في زيادة حجمه. لسنوات تلقت آلاء علاجها بمستشفى الموسى التخصصي، لكن بعد تقاعد والدها كانت العائلة أمام خيارات مستحيلة. في هذه الأثناء ارتبطت آلاء بفريق رعايتها. كانت رغم مرضها وصغر سنها تميز بين طاقم التمريض والطاقم الطبي. كانت روحها تملأ المكان إيجابية. لذلك بعد انتهاء تأمين الأب تكفل مستشفى الموسى برعاية حالة آلاء في قسم الرعاية الممتدة، لتحظى آلاء برعاية طبية إنسانية تستحقها. 23 عاماً وآلاء جزء من كيان مستشفى الموسى. قصة آلاء تمثل كل ميثاق أقسمناه. آلاء الصالح مريضة بقسم الرعاية الممتدة، وعليها سمي قسم الأطفال بمستشفى الموسى التخصصي.
I cannot speak about fathers now. Fathers' unconditional love, support, commitment, and the empowerment to their daughters is always an inspiration. Among us today is a father who sacrificed to support his daughter, ensuring that she is receiving the best care and living her best experience in life. Please welcome me the stage, Mr. Muhammad, the father of Ala.
Thank you very much. Thank you very much for giving me this chance. Actually, they hit my feeling. That's why I cannot speak. Just saying thank you for Almoosa Hospital management. Thank you, special thank for LTC group. Also special thank for Mr. Malik and أختي سارة الموسى. Thank you very much. As seen in the slides, Almoosa Hospital actually, since Ala born, she was covered by Aramco company, but after that when I retired, Sheikh Abdul Aziz Musa, Allah يعطيه العافية ويطول عمره إن شاء الله, he said, Ala is our daughter. She cannot go out from this hospital. So he directed the staff to carry all the cost for Ala. And from this member, I'm saying thank you for him. The issue that I cannot, because my feeling is not, they hit actually my feeling. So I consider myself as one member of Almoosa Hospital. I'm one of them. Every day when I visit my daughter, actually I dedicated 2 hours, 1 hour in the morning and 1 hour in the evening. When I left my daughter, I feel that I left my daughter in her home. I don't feel that she is outside, but she is like her home, and I'm coming and go back. Also, she is getting very excellent care, very excellent services. She lives with her sisters, and she's like at home. During 23 years, many things happens to Ala, and Almoosa Hospital carried all costs, even it's actually high cost when any patients go to like emergency room. It's gonna be high cost, but they don't ask me to pay anything from that for that services. So I owe them the hospital. I owe them actually very much. I cannot reback or credit them for their support and for their being like special hospital and a great hospital. So in the end, just saying thank you very much. Thank you for all they did. Special thanks for all nurses who left the hospital and who is currently now available. Thank you very much.
We couldn't do it without the support of you, Mr. Muhammad. And now we have another inspirational story.
First, I'm glad to say that I'm wearing today a waterproof makeup, so it's good for me. Okay, now we will hear another story from an emergency nurse, and we will hear his own perspective as a DAISY nominee towards the value of his profession. Please, Mr. Hamza Kubrusli, join me to the stage. خلينا هيك دلوقتي.
Thank you, Dina. Assalamu alaikum jami'an. Hello and good morning, everyone. I'm very delighted to be granted this opportunity to speak here today in the Almoosa Hospital's first International Nursing Conference, as I'm also blessed and humbled to speak in the presence of the DAISY founders, because of whom we nurses around the world are widely being recognized for what we do, and because of whom the story of Patrick and Ala will remain lasting forever, to assure us that our hard work and dedication to our patients and their families are recognized, and serves as a constant reminder of the weight and impact of our noble profession, as it means so much to us that the work that we are so passionate about also resonates with others, whether patients or family members, and because of whom we are having this wonderful breakfast where the food is so delicious. Being a nurse in the emergency room, I have been privy to some of the most profound moments of human existence. I can assure you that all my senses have witnessed a lot. As an ER nurse, you get to see and declare the moment of a patient's death, yet hear the first breath and cry of a newborn baby. As an ER nurse, you get to smell the odor of caring and touch every patient's hand in compassion, but of course, ending up in inserting a painful IV line. It is true that we get to see patients only for a couple of hours in the emergency department, but we see humans at their worst emotional, mental, and physical states, where we offer them the best care we can deliver. Such is the case with nurses in their respective departments, always providing their patients with compassionate care and extending it to their families and loved ones. Hearing Patrick and Ala's stories allowed me to embrace this aspect and appreciate how capacious, advanced, and large-scale nursing is. These stories showed me the versatility of nursing practice when seen on the floor as compared to the fast-paced nature of ER. It is beautiful, or actually it is so beautiful, to hear that the nurses in LTC have the chance to celebrate Ala on every birthday and the opportunity to greet her with a warm good morning on every sunrise. Also, nurses, even in their placid, calm touch to a sedated patient, can deliver and forward warmth to their patients' loved ones. As a Daisy Award nominee, I look at you, my dearest nominated colleagues, to tell each one of you that you have eased pain and offered hope in ways that were meaningful to patients and their loved ones. You went above and beyond to care for the needs of your patients and families. You have created an environment that fosters care and compassion to meet the goals of patients and their families. You have taken time to educate and include the patient and the family in the care process and the care plan. The legacy of Patrick and Ala serves as a constant reminder of the weight and impact of our noble profession. So always remember that you are gifted with your unique perspective and understanding of how precious life is. And always keep in mind that with your knowledge and compassion, you are making a difference every day in someone's life, no matter how big or small. Thank you. Thank you.
What a very touching morning. After all these touching, inspirational stories, we'll start by acknowledging our Daisy honoree in the third and fourth quarter 2022. Just welcome with me to the stage our CNO, Ms. Hera Tashujian, and our amazing Daisy founders to recognize all our outstanding nurses.
Each honoree will be receiving the following: Daisy certificate, Daisy pen, Healer's Touch sculpture, cinnamon rolls, and they will get the opportunity to apply certification in the ANCC. So let's start with our first inspirational story.
Hello, how are you? Good. It's my pleasure to start the first story that we have for the third quarter. I will say it just how it was written in our Daisy card. I mean, just how it was stated by our beloved patient. The patient wrote, "I was having difficulties getting an IV cannula inserted, and the fear of being pricked again and again. Failing increases my anxiety. But when the nurse came to my room with a welcoming attitude and acknowledged my fear with a sense of reassurance, After he patiently waited for me to be ready, he easily inserted the cannula and I didn't feel any pain. When I also called for the nurse, he's very fast responding. He answered me with a smile and he talked to me very calmly. He impressed me with his expertise and welcomes me very good. This is how he wrote. I would like to thank Nurse Melvin I wasn't planning to say the name, but he wrote the name in Daisy card.
Don't say the name.
He also wrote, I don't know how properly thanking Melvin for his priceless work. Thank you to all nurses who sacrifice their time to provide empathy to their patients.
Melvin, you are the luckiest. Okay, let's continue with our second story. This story was written by a colleague. She was my preceptor when I was new in the unit. She taught me a lot in all practice and procedures. She helped me all the way until I was able to be comfortable and competent in the unit. She is perfect balance of professionalism, initiative, knowledge, skill, and empathy. As a nurse, she showed real care and maintained compassion. She is always patient and gentle. She is excellent enough to lead a unit as a charge nurse and as good role model. She also supported and helped all the staff and doctors in all the chances that she had. She is well knowledgeable and skillful, and she never gets tired of sharing her expertise. She has good communication skills and critical thinking. She is able to educate the staff and especially the parents. We are so fortunate to have her on our team in the Almoosa hospital. She always practices the Ash core values in every action she made. I have never found a person or nurse more deserving of this award. Our patient is very lucky to have such a nurse to take care of them during their stay in the hospital. I am always thankful to her for always being there to support me and all the staff. I am highly nominating her for this prestigious Daisy Award, Josephine Kuhns. Josephine, you've been nominated by your colleague Rowena. NICU.
Congratulations. Now, we'll proceed with our third story. It's also a nomination by one of our patients. He wrote, "The nursing care was always excellent. The nurse was always maintaining his professionalism and compassion. He stays patiently for my comfort. He's always smiling. I would like to thank him for the respect he offered to me with all love and care. He involves the patient and the family when he visits for the treatment and the follow-ups. He is also good at communicating with my doctors when he updates them on the treatments and interventions. He is highly professional and provides great help whenever needed. Thank you for being such a wonderful nurse. This is Dina Wash. Let's say the name. The award goes for Mr. Mazen Hudayfa. Congratulations. We have to highlight that Mr. Mazen received Daisy Award for the second time.
We will continue by our fourth story. She came as a typical first-timer foreign nurse, she was shy, introverted, not confident, and passive, but the difference is I saw the compassion and care she gives to the patient that really comes from the heart. What is outstanding about her is that she never complains about whatever her duty would come, whether it's busy shift or an easy one, whether she has difficult patient or relaxed assignment. She still smiles and continuously displays calmness and dedication all throughout her care. Now that she is one of the senior nurses, her caring and compassion intensify, and she's more responsible. She developed a sense of accountability, flexibility, and maturity in dealing with complex. Her compassion never changed, and this reflects her care during her tenure in the unit. Not a single complaint from the patient or family, just high praises and thanks for the remarkable and exceptional service. Truly, she is a nurse that you can trust, depend on, and be assured that our patients are in good hands. Mrs. Hanlet Costantino. Miss Hera. Miss Hera, just for the photo, can we come for the photo just? You were nominated by a colleague, Rosario Tiong.
Now, I have a very unique story. It's written by one of our colleagues. She wrote, he was pulled out to our unit to help our staff, but the moment he joined the shift, he blended immediately with the team. He's very helpful, even though he is not assigned to the patient, as well as other nurses. He always asks, how can I help? His joyful personality brings the team lighter and radiates his happy aura to everyone on the floor, even if the unit is full and busy. I'm happy working with him and proud that we have such nurse with bright personality. I'm nominating him for the Daisy Award due to the extraordinary personality that the care he's giving every day to our patients and the work he's providing and the support he is giving to the team. The award goes to Mr. Wilson. Congratulations, you were nominated by your colleague Elizabeth.
Thank you all.
It's my pleasure to add an additional story. Our patient wrote, I'm a sickle cell disease patient. Unfortunately, they pricked me multiple times that I lost track of the count, and then finally the nurse came and she was able to insert the cannula from the first trial. She was very confident and respectful. I would like to address the most precious people that support her or who support her, especially her parents. And she wrote, Assalamu alaikum, your daughter applies the rule and attitude of compassion, not just during the physical treatment, to excellent and psychological support. And there is saying, put a little bit of empathy on the brain so it softens, and little bit of wisdom on the heart so it straightens. The award goes to our amazing ER nurse, Dina Mayas.
Oh my God, I'm so happy. Thank you so much. Thank you. By the way, it's one of my dreams in my profession to be Daisy awarded.
She kept saying that when
Thank
my
you.
dream will come true.
Thank you so much. Wow. And I like this picture. Oh my God, thank you. Can you put the screen? My God. So I'm the luckiest now. Yeah, thank you so much. Thank you. Wow, so much. Thank you.
It is not the end of our celebration. I'm honored to invite all our Daisy nominees to stand up and share with us the celebration. Please stand up, those who are joining us physically and virtually. Thank you for joining us.
Can you please open your cameras if you are able to hear us?
We actually have different nurses from different cultures, different backgrounds.
Hi.
Congratulations. We have some nurses joining us from the hospital. Well, thank you for your dedication. Are you going to have a photo with them? Okay.
should I continue? Thank you so much. Thank you for the surprise. Thank you.
مبروك يا عمر مبروك. We'll give you two minutes to take a deep breath. After all these gratifying stories and recognitions we previously heard, slow down your heartbeats as I warmly welcome our moderator, Ms. Qamar Yunus, to the stage to lead the upcoming session.
Ms. Qamar Yunus was graduated from the American University of Beirut in 2016 with a bachelor's degree in nursing in 2022. She obtained her master's in adult care and gerontology clinical nurse specialist track from the American University of Beirut. Her experience is in critical care nursing. Qamar is a member in the American Association of Critical Care Nurses and a member in the Sigma Theta Tau International Honor Society of Nursing. Qamar is now the cardiovascular clinical nurse specialist and the stroke program coordinator at Almoosa Specialist Hospital.
Thank you so much, Dina. I'm so glad to be moderating this panel today and be among these great attendees. So, as you know, the accreditation journey at our hospital doesn't stop. So we're not only seeking for magnet, but we're also pursuing the PTAP accreditation, the Practice Transition Accreditation Program. So today our panel will be having experts in education, PTAP, and two nursing students who are beginning their transition process. So let's start our session today with the two nursing students, Sarah Al-Mushaljil and Suha Abdul Mohsin, who will talk about the person-centered care through the eyes of a nursing student. The stage is yours.
I didn't expect today.
Good morning. I'd like to start my speech with a question. How did you get to your seat? You've all succeeded in something, whether it was in your schools, careers, or anything in general. Now, I'm on my journey to this seat, and I'd like us to all think together, how was your previous journey? Who was there? What experiences did you have? And maybe your journey is just like mine. My name is Sarah Mjeljel, and I'd like to share my experience with you all today as a student at Almoosa College. This stage, standing here, this is part of my academic journey. However, this isn't the start. It all goes back to 2 years ago when I decided to become a nurse. I registered with Almoosa College, and a part of this registration process was an interview. Yes, you heard me right, an interview. I was so stressed. Are they going to like me? Are they going to accept me? And so on. Wouldn't you be? I had to sit in front of a panel that had a bunch of doctors, professionals, teachers, and even a student. Yes, a student. I was so shocked to see a student there, and I had never seen a student in a position like this before. Although I was shocked, I was also proud that a student just like me is going to be part of my admission. Oopsies. And then I popped this question to myself. Could I be that student one day? And after the wonderful news of my acceptance, there my nursing journey began. And so I experienced my first orientation. Everyone was so helpful. And by everyone, I mean teachers, doctors, counselors, and even senior students. The senior students did a good job at giving us advice that felt so real and encouraging to me. And I felt like, yes, I could actually make it to the end just because I saw someone stand on the stage just like me.
first year, my view about studying has changed. My teachers were a part of my studying right from the beginning. I've had goals and decisions and plans to make by myself. It was my learning process. It was about me. And as beautiful as it sounds, it wasn't easy at all. It was rather difficult. I remember participating in Alzheimer's Day and creating new ideas to the medical community. I couldn't believe how confident I was leading my team and being supported by them. And in my second year, I realized that I own my education, my academic and personal growth. Me and my colleagues realized that the textbook was no longer the focus. Real life experiences were. I remember another challenging situation, the strategic planning event held by our college, Almoosa College. Now put yourself in my shoes, hearing the words strategic planning for the first time. It grew some kind of fear inside me. What? I mean, put yourself in my shoes, hearing the fancy words that I can only hear in TV, hearing them in real life and being a part of it. I collaborated with teachers, doctors, and peers from the medical field.
And now, as we go on to my third year, I was a different person. I was a different Sarah, and I could not believe that. I was more confident, more courageous, more persistent, and now I can easily display skills that need leadership and independency. I started to see my learning as something that meant a lot to me rather than just books or tests. I learned skills about myself that I never thought that I had, which is pretty shocking, I'm not gonna lie. I learned to put feelings forward like compassion and empathy, and these are the exact skills a caregiver needs. I can now make my own decisions and fully understand how these decisions influence me and my future patients. I can now stand confidently in front of you, and when I look back, I see my journey. I can take what I learned and use it for my peers and I learned things about collaboration, and most importantly, I learned about the importance of communication between my future patients and peers. I can now influence the lives of others and help them find their own way and be an active member of the community.
Do you remember the innocent candidate that was impressed by seeing another student interviewing us in the panel? Now she is standing in front of you as a member of the same interviewing panel that interviewed us years ago. Now let's go back to our introductory question. How did you all get to your seat? Have you gone through the same step that we were going through? Because in my journey in Almoosa College, I could see the light at the end of the tunnel right from the beginning. And the way I've been taught is called person-centered care. So what is PCC? PCC is an innovative approach that puts the students at the center of the learning process. Not students only, but teachers too. And it focuses on competencies like innovation, shared decision-making, evidence-based practice, professionalism and leadership, community, teamwork and empathy, student engagement.
Thank you, Suha.
Thank you, Sarah. I would like to add a personal note, if I may, about my experience in Almoosa College. Being in a student-centered way, educated in this way, made me feel so warm and made me feel supported as if I were in my own family, between my family members. And this also motivates me to become an ideal outcome of person-centered care. Thank you very much. Thank you.
Thank you so much, Suha and Sarah, for your great talk. You inspired all of us, and I hope all nursing students are envisioned in their future the way you do. The future of nursing is in your hands. Please take good care of it. Now, it's my pleasure to introduce our distinguished guest. So, as you all know, we don't only have the Queen of Magnets, we also have the Princess of PTAP, Dr. Cheryl Cosme. Dr. Cosme is the director of the Practice Transition Accreditation Program and the Advanced Practice Provider Fellowship Accreditation at the American Nurses Credentialing Center. She's responsible for ensuring transition to practice programs abide by the accreditation criteria set forward by the ANCC. She has published numerous articles on transition to practice programs and evidence-based practice. Dr. Cosme presents both nationally and internationally on transition to practice. She serves as an associate editor for the Journal of Continuing Education in Nursing and is the past chair of a national collaborative for improving the clinical learning environment. Thank you so much.
Thank you, thank you, thank you. I don't know about all of you, but I need a minute to just take a deep breath in and out. Let's do it again. In and out. What a moving morning so far, and I feel like I'm not privileged enough to stand on this stage with all of you, but I am ecstatic to be with all of you here in this room and those of you joining us virtually. As you just heard, I am the Princess of PTAP, followed by my queen, the Queen of Magnet, Dr. Maureen Lal. And what I'm here to talk to you about is transition to practice. But I want to first get a sense of all of you in this room. How many of you have transitioned in your nursing practice? How many of you came to this country and started working at Almoosa Hospital from a different country? Please stand up. How many of you have transitioned from being a staff nurse to a leader? How many of you went from student to registered nurse or to clinical nurse? Every single one of you should be standing up. Every single one of us in this room has gone through a transition in our lives. Within a transition to practice, we are looking at a comprehensive way that we support and educate nurses through that transitional period where you feel a little unsure of yourselves, where you just need that extra hug or that extra pat on the back or that encouraging word from your preceptor. Transition to practice is a comprehensive period of time where nurses teach you how to deliver safe patient care. Successful nurse residency programs are structured and standardized, they're evidence-based, and they give you time with your clinical preceptor to be successful. They engage all of your stakeholders, their evaluations, and there's always that constant process improvement to wanting to be better and brighter and more spectacular. Accreditation is a voluntary process that actually Almoosa has chosen to go on the journey of. And we actually have 2 accredited nurse residency programs in our room, King Faisal in Jeddah, which you'll be hearing from soon, and King Hussein Cancer Center in Jordan, and some in the room that are on the journey that I can't mention just yet. Your organization, Almoosa Hospital, has chosen to go on this voluntary journey to accredit its nurse fellowship program, which I'm honored to help you all hopefully achieve that distinction in the next couple of months. So what is PTAP? PTAP is a comprehensive accreditation program that looks at 5 distinct domains. Program leadership, that says that you have a leader guiding your fellowship and is accountable for your fellowship to ensure that you, all of you transitioning into your practice specifically from another country into Almoosa Hospital, have that support to be the best and the brightest nurses that you can possibly be. Program goals and outcomes are those measures that the leaders in your organization use to show you if you've achieved those goals or not. Your chief nursing officer and Henna are the ones that are hopefully leading you, and hopefully it'll be added to your dashboards. I know we don't have a button for that like your nurse call system, but possibly there's an opportunity to add that to your nursing dashboard of how successful your nurse fellowship is. Organizational enculturation in my world is the hug that you get from Almoosa Hospital. It's the hug that you get from Hera. It's the vaccine of Almoosa nursing and why you are spectacular nurses. It's that enculturation into this culture and any culture that you are a part of. Development and design, for those of you that are leaders and faculty members out there, is the what's in it sauce. It's what does the curriculum consist of? What are those competencies that you are required to attain by the end of that fellowship program? Who are your preceptors? Who are your faculty members that are teaching you how to be spectacular nurses? And then my favorite domain within our PTAP standards is that practice-based learning, which I like to consider boots on the ground learning and how you learn in your clinical learning environment. So how do you become a spectacular critical care nurse or an emergency department nurse or a NICU nurse? That's the boots on the ground learning that you receive from your preceptors and your faculty members. We all know that nurses go from novice to expert by our dear Dr. Patricia Benner, and we know that you pass your entry-level licensure exams to become amazing nurses, but there's always opportunities to grow. And that's with an accredited program. You are provided with that time and support to grow into your role as a professional nurse within your organization. The ANCC recognizes two very distinct types of programs. Our nurse fellowship, for those of you that are fresh new graduate nurses, which we'll have a few very soon from Almoosa Hospital, and how the organization supports those new nurses to practice, where they are given that organizational enculturation, those precepted experiences with their preceptor, and then those supplemental activities that give them that didactic experience to be even more spectacular, such as evidence-based practice. The second type of program that we accredit, which Almoosa is on the journey for, is your nurse fellowship program. So those nurses that are transitioning from another country into the wonderful kingdom of Saudi Arabia, how were you enculturated into this practice and into this environment, which many times is very different than where you probably were practicing before in your own country? How were you supported to understand the policies and the procedures and what nursing practice is here within Almoosa? So the impact of PTAP has been measured twice so far in our 8-year tenure at the ANCC. And over the last 8 years, we have seen tremendous growth within the PTAP program, as well as the impact that it has on organizations that go through this voluntary credential. In our first analysis of our data, we found that organizations that achieved PTAP recognition had increased leadership support, both financially as well as through recognition. Stakeholder engagement, not only from those internally but externally, had increased. National and state recognition was seen through our organizations, through actually some organizations being given state recognition, credibility of the program that it is doing the right thing for its nurses. Funding, which many of you leaders are always wondering about. Those programs that have received recognition are then potentially given the opportunity to receive additional funding from their organizations or externally from beneficiaries. And then just collaboration with others from our nursing schools, from those at other organizations. And I hope potentially in the kingdom, maybe there'll be an opportunity for our accredited programs to partner and collaborate and maybe have a national nursing residency and fellowship task force where you're working together collaboratively to improve practice for all nurses. Of course, during the pandemic, we were a little bored at home watching what was happening on TV, so we decided to relook at our data. And in our second analysis, we not only found those 6 initial impact pieces, but we found 12 factors that influenced an organization by attaining PTAP. Our organizations reported an increase in their recognition from internal and external stakeholders. The recruitment of nurses from across the country and across the globe increased in a large number of our programs. Resources were increased because the organization or the program was then proving to the organization that it was being beneficial and actually saving these organizations money. And then one of my favorite things is that professional dissemination, which only a few of our organizations reported on, but reporting out, like Dr. John will in a little bit, about their impact of their residency has been important. Of course, we love data, and I know Maureen loves data as well at the ANCC, and we just received our 2022 impact data or influence data, and I'm happy to know that we have even more influences from being recognized as a PTAP organization. So our statistician looked at our information and our data and found that recruitment was still one of the rising trends, resources one of the additional trends, and one of the things that I'm most proud of is our academic partnerships that organizations have embarked on, because as you heard yesterday, academic practice partnerships is one of the cornerstones, and I know will be one of the cornerstones of the program here at Almoosa as you get forward to inviting your first class of new graduates into your organization. So in 15 short minutes, what does this all mean? Every single one of you has an opportunity to impact a new nurse when they come into your organization. And all of you as organizational leaders in this room have an opportunity to potentially impact your residency or fellowship. And hopefully you will seek accreditation for that to receive that stamp of approval, I like to say, from the ANCC. So how to leverage your nurse residency or fellowship program is that accreditation has continued to show programmatic and organizational impact across the globe. We are seeing even more relationships and influence of having an accredited program within our organizations that are accredited. We are starting to see saturation in those themes for my qualitative researchers out there, and we love data. And I think one of the important things for those of you that are working in organizations that don't have a formal residency or fellowship just yet, I encourage you to go home to your home organizations and go to our website and download the standards and say, I think we can start this here at our institution. This is attainable, and similar to the magnet model, you don't have to seek accreditation. We encourage you to, but the framework provides you with a roadmap of how to get from the beginning into the end and to have that successful journey for a nurse during the beginning of their career, during their beginning of their time in your country, to the end, and to being that successful individual. So for those of you that are leaders in this room, these are the steps that I encourage you to take. So one of the things that I love to share during my presentations is that PTAP is making a difference. And so my dear friends over there, I'm going to get ready for you to cue the video. Let's see.
The impact of working at an organization that has earned accreditation from the ANCC Practice Transition Accreditation Program will stay with every nurse throughout their entire career. That's why having the right resources and support is essential for a smooth transition from the beginning for any registered nurse or nurse practitioner.
As a director, I always think about what kind of courage are we instilling in our nurses, and how much do we give them the opportunity to really be able to talk about where they want to go and where they see their career evolving, and how do we create an environment in which to foster that?
You have those people that you know you can lean on. You know, you have those people that you know are supporting you, that are in your corner, really trying to help you transition to be, you know, that successful nurse.
We give them not just the knowledge that they need to better care for their patients, but we also give them the confidence and the competence needed to successfully practice in critical care.
Getting accreditation from the ANCC, it's something you need to do, you know, to grow, you know, to continue to be dynamic and grow with change.
It really is an opportunity to do a deep evaluation of your program, of what you are doing, what you need to do to strengthen your program, to become a better program.
Knowing that I was at an accredited residency program meant a lot to me. just knowing that there's evidence-based practice behind what I'm doing.
The ANCC seal of approval on our program really lets everyone know that our program is robust, especially in the times of COVID, when budget cuts have become very apparent. We received notification that we were able to expand our program this year in the midst of severe budget cuts, and I fully believe that that is because of our ANCC accreditation.
There's a sense of, okay, if I go to that accredited residency program, then I know that there's a quality attached to that. There's a value attached to that, and that they have proven the success of their program.
And you are the first ANCC accredited program in Washington, D.C.
After receiving the ANCC accreditation, the majority of the new graduate nurse practitioners who seek out our program are doing so because of the accreditation.
There was just so much support from the ANCC.
The other thing that I really think that accreditation brings, and I've really appreciated, is the community that you become a part of.
Receiving the phone call about the decision that day in January was one of the best moments of my professional career.
PTAP is the global leader in transition to practice accreditation for registered nurses and APRNs. Join a community of global leaders elevating their nurses and APRNs with PTAP accreditation.
Thank you. So as many of your organizations embark on nursing excellence, I think it's important to remember where every nurse starts at the beginning of their career or during a transition into your organization. You have the power to infuse nursing excellence as you introduce those nurses into your organizations. And through a robust, supportive environment, you can teach them what it means to be a King Hussein nurse, what it means to be an Almoosa nurse, what it means to be an IMC nurse, what it means to be a King Faisal nurse. Because at the end of the day, when new nurses are invited and brought into your organization, the one thing that you want is to keep them there. You want to retain them. And one of the strategies that all of you can use in your organizations is by implementing and supporting your entire nursing staff by having a nurse residency or nurse fellowship program. In the literature, they have been proven to be successful, and this was just the very tip of a very large iceberg on the evidence and research on nurse residencies and fellowships. I encourage all of you to reach out to me. I am on LinkedIn as well by Cheryl Kazmi, but I welcome all of your questions during our panel, and I'm going to turn it over to our dear Kamar. Thank you so much.
Thank you so much. Thank you so much, Dr. Sharif, for your detailed explanation of the PTAP program and showing its importance and impact. Now, allow me to introduce our second distinguished guest, Dr. John Sidgwick. Dr. John Sidgwick holds more than 35 years of experience in many nursing and education roles. He has a clinical background in surgical nursing, hemodialysis, renal transplantation, and general nephrology. Dr. John was the program director for the postgraduate studies at the University of Teesside for almost 12 years. Dr. John's journey started with a Bachelor of Science in Nursing at King's College in London. He also got certified as a specialist in renal nursing from Bournemouth Hospital. He then obtained a Master's of Science in Nursing from Manchester University and the Master of Science in Health Sciences Research from University of York. He holds a Doctor of Philosophy in Nursing with a nephrology specialty from the University of Sheffield. Lately, Dr. John obtained a certificate in coaching from the University of Cambridge in UK. He's the Director of Nursing Education and Saudization at King Faisal Hospital and Research Center in Jeddah since 2012. He's the Education Consultant and the Faculty Chair for the Middle East and Africa Renal Education Program at the European Dialysis Transplant Nurses Association and European Renal Accreditation Association. Dr. John is the chairperson of its accreditation committee. Dr. John, the stage is yours.
صباح الخير.
fala cael iom. Anna calamanabi swain, nus. Okay, so good morning, everyone. It really is a super pleasure to be here, and I want to firstly thank the organising committee, Hira, and all the team for this amazing first international conference. It just really is an amazing, amazing event. Can we just give them a round of applause, please? Thank you. Secondly, I would like to say a huge thank you to the Princess of PTAP. Without your support, Dr. Sherry, we would not have achieved what we have. So hopefully today, what I want to do is just share our story. But before I do, I want to recognise the most wonderful team of educators that I work alongside. Ragda Nazar, Amna Shalani, who can't be with us today. So just a few quick things I want to talk about today. First of all, our journey. What was it like? What was the pain? But what was the success we went through? I want to talk a little bit about the curriculum that we implemented. Why did we want to be innovative? Why did we want to stretch the boundaries? Why did we want to cause ourselves more stress? I'd also like, importantly, to say a little bit about the business case. How did we convince our key leaders of the importance of this program? And finally, just to follow on from what Dr. Sherry has mentioned, some of the important benefits that we've noticed so far in our program. I'd like firstly to recognise the superb work that's been undertaken by our colleagues also internationally. Our colleagues in Belgium, who were the first program to be awarded, the King Saud Medical City in Riyadh, thank you for all your hard work, to the King Hussein Cancer Centre, Jordan, thank you. So just briefly, a little about King Faisal in Jeddah. We're a 500-bedded tertiary hospital located in the Western region. We have numerous accreditations like many hospitals, and we're about to have our third magnet designation visit on March very shortly. We have a range of medical services, highly specialised transplants, cardiac and so forth, and we have approximately 4,000 staff, and of those, about 1,300 are nurses. I have the pleasure to work alongside the most amazing team of educators that I've ever encountered in my professional career. My team come from all corners of the world, the Middle East, Asia, Africa. We actually receive students from across the western region of Saudi Arabia. Many universities, we have placements with those academic institutions. This is just one group of the students that have been through our program. We have a student intake of baccalaureate for their internship, undergraduate, but also master students. So we have very strong academic partnerships in the community, which we're very proud of. So a little bit about our journey so far. So first of all, in 2018, we began to undertake a review of our current curriculum and our program for our practice transition. It wasn't quite working in the way that we wanted it to. We engaged our internal stakeholders and external stakeholders quite extensively to think about where we wanted to go for the future. I had the pleasure to attend the PTAP symposium. Dr. Sherry might remember. I met her, I think it was in Atlanta, where we sat for a few minutes and talked about, are we ready? And she gave me that sort of push to move forward. In January 2019-2020, we submitted our application, but COVID came around, it impacted us, and we had to defer. But that didn't stop us. We continued the journey. We resubmitted our application in 2021, and in January of that year, it was accepted. We submitted the documents, and they were huge. This is me and my team running around with all the documents, but it was worth it. We submitted our documents, and they underwent ANCC review, and then in June of 2021, we had the most amazing virtual site visit. The excitement in the hospital was palpable. We'd worked so hard, and then we received the announcement in August of that year of accreditation Not just accreditation, but accreditation with distinction. And I'm pleased to say, and I will always fly the flag, that we were the first hospital in the world outside the US to be awarded accreditation with distinction. I think that deserves a round of applause, everyone. So, even though we had restless nights, countless calls with Dr. Sher and her team, who, by the way, were amazing, we got a wonderful call. Play the video, please.
Awarded accreditation with distinction.
Do you think we were happy? We certainly were. Next slide. I'm just showing you that slide because we attacked the accreditation process with military precision. We had writing teams, editing teams, we had clinical partners working with us. This was not just about the Department of Education working in isolation. We had colleagues from practice, academia. So those of you that are on that journey will know just how important the project management around this is. This was one of the frameworks that is embedded, as Dr. Sher has already mentioned, within the Practice Transition Programme. So you can see the key domains that were actually central to what we developed, as well as Benner's model in skills acquisition. We also wanted to actually build on the CUSIN framework from the US, which stands for Quality, Safety and Education for Nurses. We recognize that our new graduates, when they come into the organization, they've got a lot of skills already and a lot of knowledge. What we wanted to do was enhance and build on that and apply it to practice. Our program is 12 months in length, as you can see on the screen here. We have a module on CUSIN, and that spans the whole year. We have actually 8 work-based learning days across the year, and it's very interactive, it's participative, it's fun. Our new graduates help tell us what they want from the work-based learning days. They shape their learning with us. We have 20 clinical pathways in our program, 20 specialist tracks for our new graduate nurses. And this is just one example. So you would do a module or a unit which looks at the fundamental of that speciality. All our pathways build on international best practice standards. They're mapped into every pathway. We have a module around developing clinical skills that spans the whole year. Again, it's highly integrative. And a module around striving for excellence, quality in patient care. So just a little bit more about the program itself. So we have a 1-year program which is based on a core curriculum. The core curriculum philosophy is we can bring learners together for real important points in learning. Then they can branch out for specialist learning as well. We've embedded the Benner framework very successfully, as well as CUSIN throughout our clinical assessments. As I said, we have 20 clinical pathways. Each pathway has an academic team who support that individual. They work in a pathway leader role. So they have a quasi-academic role as well. There's a pastoral supportive role, as well as being content experts. They follow their new graduate in partnership with their preceptors in practice. We have 8 work-based learning days I've mentioned already, which is focused around clinical specialism and CUSIN. And we have a highly successful onboarding process for the new graduates, hospital as well as general orientation. We have a variety of creative assessments built into the program, formative to enable our new graduates to learn and develop with support, as well as endpoints that they need to achieve. One of the hallmarks of our program is based on some empirical research that was undertaken at King Faisal and Jeddah on the SMART mentoring program. SMART standing for Students, Mentoring, Achieving, and Researching Together. We have a robust mentorship program built in, where students peer mentor each other from previous cohorts. We develop our mentors. We have a whole program for them, which also includes certification as the psychology of mentorship. We don't have enough time today to talk about the mentorship program, but it was based on some research by one of our educators, and it was an IRB-funded research project. A number of quality outcomes are key to your program. So we looked at nursing professional development, self-report, practice-based knowledge, and retention. We wanted at least 15% of our newly graduate nurses to complete at least one professional development activity, but actually the percentage was much higher. We want to improve our new graduates' perceptions of stress. We use a well-validated tool, the Casey Fink tool. We work closely with our research centre. The data is so important. As we collect the data at 0, 3, 6, 9, 12 months, we feed that back continuously to our clinical partners, but importantly to our new graduate nurses. We tell them what we see is happening for them. One example, our new graduates talk about death and dying and bereavement. So we changed some of the work-based learning work. We worked with our clinical partners to respond to that data. And it's important that data is shared across the organisation, and that's shared at high levels with our executive teams, unit level with the head nurses and the preceptors. Also, patient safety was a big concern for our new graduates. Again, this is picked up consistently in the Casey Fink survey. We work hard with our new graduates and our preceptors to ensure that they feel safe, and where they have some concerns, we feed that back to the clinical units. Our retention rate we wanted to set at 90%, which we've achieved. As I said, we have various evaluation methods in the programme, from how we evaluate the work-based learning day with the new graduates themselves. The clinical privilege framework for the new graduates is well developed. There are 8 core privileges they need to achieve in the first 12 weeks, and then their specialist privileges are mapped out across the 12 months, depending on the complexity. And again, the preceptors are absolutely key to this program. We have a really wonderful preceptorship program. We recognise and support our preceptors. The preceptors also the preceptors evaluate the new graduates. So we get constant feedback, and it's shared transparently with the new graduates. As I said, we have lots of different approaches to assessing the learners, and the learning assessment resides with those new nurses themselves. So they actually help direct their assessments with us in practice. They set up care study groups with the multidisciplinary teams. One message I would say is the governance of a practice transition program is absolutely key. As I said, we have a program coordinator and assistant program coordinator, Ragda and Amna, that I mentioned today. As the director of the department, I mentor and support them. I'm overall responsible for the program, but I work very closely with them. And their role is to ensure the delivery of the program in terms of meeting quality outcomes and standards. The pathway leaders have a very specific responsibility. So there is a clear role outline of what's expected in terms of how they deliver their pathway, but also collectively as a team, what we're trying to achieve. And they manage their pathways with their clinical partners and academic partners. We have the Professional Development Council, because certification and development is really, really important in our program. So we work very closely with the PDC. The Nurse Executive Council is the highest level of decision making at King Faisal. And so within that council, we have a responsibility to report quality outcomes, feedback, evaluation, and also get feedback from senior leaders in the organisation. This was important when we were creating our business case. When I presented to the Hospital Accreditation Committee, to the finance directors, the evidence that Dr. Sherry mentioned, really having the data to show that it does work. Importantly, we have a Practice Transition Oversight Committee. This is a committee that comprises various representatives within and outside the organisation, our academic partners, deans from the universities, past alumni from the programme. We have members that contribute to the programme, such as psychologists that teach mindfulness and stress reduction, as well as preceptors. It's a really important part of the programme. Our data speaks for itself. I'm sorry this looks like a little bit of a busy slide. So we had a transition to practice program before we achieved accreditation. But in 2017-18, we began to change our program You can see how many completed and how many remained in the organisation at the end of 2 years following completion of the programme. Our programme started essentially in 2018-19, although we were not accredited until 2021. But again, you can see the data. We have a lot of applicants to our programme. It's very competitive. We're governed by the number of places that are available. But you can see year on year, apart from 2021, where there was a slight dip, the impact of COVID and so forth. But I have to say, the data tells us it works. You see our new graduates a year, 2 years in practice, and they are truly amazing. And I truly believe that this framework has helped them on that journey. So just before I finish, just a few benefits. Again, I promised me and Dr. Sherry didn't share our slides, but they'd really just support what Dr. Sherry's just said. Improve recruitment. We used to get between 80 and 100 applicants annually for our program. Now it's 250, 300. The message is out there. We work very closely with our universities. We do marketing events. So it's branded our program. We're passionate about our new graduates. We know our new Saudi nurses are the future in the kingdom, and we're committed to supporting them. Saudiization. We all know the kingdom has a massive drive towards improving Saudiization. Our new graduates are an important pipeline towards Saudiization. And we have seen substantial increase in our Saudiization rates as a result of our program. And that is important for the stakeholders. Enhanced retention. I've said already, new Saudi our nurses, if you spoke to them, they tell you how satisfied, how happy they are in practice, how fulfilling they feel in their role on a daily basis. The positive impact on turnover. We're seeing very few leave the organisation. In fact, the very few that we have lost actually went to Riyadh, our sister hospital. We are a three-sister system, Medina, Riyadh and Jeddah. So we really haven't lost any of our new graduates. And it's amazing to see these wonderful new nurses in the future. Return on investment, absolutely is key. The ANCC have a wonderful return on investment calculator that you can work out the costs. So it does actually save. Career development. We've introduced 20 clinical pathways for new graduate nurses. And that provides a whole new world for our new graduates to actually specialise and develop. We have an amazing preceptorship program. It's called the Tripartite Preceptorship Program. We have a primary, an associate, and also the individual themselves. We have a very robust process of recognising our preceptors within the organisation. Our preceptors love flowers and chocolates and celebration, and any opportunity for a cake, we're there. But it's just a way of recognising that we can't do this in isolation. We can't do. My team, my department exists for one reason, to ensure that our nurses are safe and delivering culturally competent care of a high quality. One of the hallmarks of our program is the evidence-based practice posters that our new graduates actually produce. From day one, right through the program, we work with the research nursing specialist team and introduce and extend the knowledge of our new graduates. Remember, they're not empty buckets. They've come in already with knowledge, and we want to enhance that. So they work in teams, and they work on projects linked to their practice area that are linked to the strategic priorities of the organisation. So there's real buy-in, and throughout the whole year, they get support from academic teams to develop their posters. And this is one of our learners presenting. We celebrate the posters. This is just one of the rooms off the auditorium. The posters are just outstanding. We invite the mothers and the fathers and the husbands and the wives to the graduation day. In fact, our last graduation day, we had a mother and father actually present about their son and daughter on the graduate program. So it really is a superb way of closing the program down. Many of our projects have either gone into performance improvement projects or gone forward to potentially RB-funded projects. So to celebrate, really we bring everyone together to say, job well done. We've got a lot more work to do. We know the gaps that we still have. We're still learning, we're still developing. But we're very proud of what we've achieved at King Faisal and Jeddah. our stress levels are about to start pretty soon, yeah, as I was saying to Dr. Sherry recently. So the new standards have just been produced. And so we will be starting the whole journey again. We'll be reapplying in January 2024 and submitting in May 2025. The secret now is, how do you hang on to that distinction? What have we done? And we've done some amazing work, hopefully, to do that. So thank you, everyone, and thank you for your time this morning.
Thank you so much, Dr. John. Really, how successful was this PITAP journey? Kindly stay with us here on the stage for a 10-minute panel discussion. I will also invite Dr. Sherry and Saya and Suha, the nursing students. Thank you so much for your... Dr. Sherry, I'll start with you. I have a question. You know, we are applying for the PTAP very soon. And you know, we're opening the rehab center also in a few months. So what advice can you give us to have a smooth and easy transition for our nurses from the current practices they're having now in the current hours to a new specialty, which is the rehabilitation?
Opportunity, opportunity, opportunity. With your organization opening your new long-term care facility and rehabilitation, your organization has an opportunity this summer as you get ready to implement a fellowship program for maybe those nurses that are choosing to transition from med-surg to long-term care or critical care over to the long-term care facility. So I know hopefully your education department is thinking about how they can transition your current employees to that new environment, potentially through a fellowship program, in addition to your current fellowship program that you have for nurses new to the country. So opportunity is what I see.
Thank you so much. Dr. John, you said that COVID-19 was one of the challenges that you faced during your journey and you had to defer the application. So after COVID-19, how you got your nurses back engaged in the program, especially preceptors, how you put them back on track so they continue this program and this journey?
Thank you. That's a great question. Well, firstly, during the COVID crisis, we had to migrate to virtual for a lot of our program, which was quite a challenge in many ways. We were aware that our new graduates were desperate for the in-person program. In fact, it didn't take long. People were waiting to start again. So once people felt safe and our infection control teams gave us the green light, we just had the model ready again and we just ignited it. We just lit it up again. And quite honestly, it didn't take too much work. In fact, I think, if we think about the world of virtual learning, there's an important need for contact with learners. And whilst our learners we didn't have choice, we had to do the virtual model, they were desperate to have that face-to-face contact. And it happened, no problem. We ignited it and it started straight away.
So much, interesting. Hello. Thank you so much for being with us today. So Suha and Sarah, you said that you were the center of care in your college, the education you received, you are the center of this education. In a few months you will be graduating and start to deal with patients. So how you will translate this person-centered care when you become a resident nurse in the hospital you're going to work in?
PCC allowed us to put our patients in the center. No.
Your voice is
PCC allowed us to put our patients in the center of care, and that gives our patients autonomy. They can now make their own decisions and share these decisions with their beloved ones. PCC also focuses on their values and preferences and what they like and what they don't like.
Yep, so basically the strategies that we were taught at school, we do implement them with patients when we go to practice for clinical. So we learn about competencies like like the domains like giving empathy, being culturally sensitive, basically including the patients and put them at the center of the cycle of care for the patients. So as we learned, we put patients and make them involved with their families while making the decisions, and this way we can build a trust and rapport with the patients.
Thank you so much.
Thank you very much.
Dr. Sherry and Dr. John, you see these fresh nurses. What advice can you give them to avoid?
So, what's the question?
Okay, so we have two fresh nurses here. They're graduating soon. What advice can you both give them to avoid a reality shock maybe later? Or
So, Sherry.
You will go through reality shock. As much as my dear friend Kamar said you won't, it is proven in the literature that every single nurse that goes through a transition, no matter if they have support or not, has that moment where they wake up one morning and they're taken aback and they're shocked by the reality in which they work in. But through a residency program, those educators within the healthcare organization and your preceptors in that healthcare organization are going to support you through those moments of uncertainty, and you will get through that rut, I want to call it, and you'll be even better at the end of it. But it is every single one of us went through that moment of reality shock, and we get through it. So be prepared, and you'll never know when it's going to happen, but you will have the support from your colleagues to get through it.
Just a comment. I want to share a story, unexpected story that happened. Our new graduates, one day we're all having coffee, and I went and sat down with them, and they looked very unhappy. And I said, Lish, like, what's the matter? They said, oh, Dr. John, our parents are not happy. Why? They said, now that you're a nurse at King Faisal, you come home at the end of the day, you look tired, you look exhausted. We don't see you very often. That made me realize that we need to mobilize the support from the family. The social structure of the family within your culture is really powerful and important. So now what we do, we have a family day. We introduce the family, bring the families in to King Faisal, and we tell them about the journey of the new graduate. So sharing that journey with your family, helping them understand what you're going on, is really important. And I couldn't agree more with Dr. Sherry. You will have peaks and troughs. Your preceptors and your family mobilize your support, and you will get there.
So I would like to share some personal feelings. As a student, especially going to clinicals from the first and second year, it feels like jumping into uncertainty. So training in a big hospital, like going to training when I have only little of knowledge, little of skills, basics only. However, even though it felt vague, even though it felt like I felt less of a student than others that might be training there, because usually they go training in later years. So in our college, we start training a bit early. So even though I came out with something, I learned new skills while training. Even though I was very young, going to train in the hospital, I learned it was beneficial. And I would like to personally thank all the preceptors, and my preceptor is here. I would like to thank her. In the OB. Thank you for being there, and thank you for teaching me and making me eager to learn.
Thank you so much. Thank you so much. Now we'll open the floor to our attendees if they have any questions.
Great panel discussion. Dr. John, question. Have you looked at the data retention data pre-transition program to see what your retention rate is compared to today?
Well, firstly, I know for certain that those that started in 2017, some are definitely not with us now. Absolutely. And we're looking at that data now. In terms of retention, our retention pre-program was certainly less than it is now. I mean, at the moment, it's about 98%. We were never anywhere near that. We had a great program already, but in terms of actual percentage, we were probably around about 60, 50, 55, 60. It really has improved our retention rate.
Any more questions? Yeah, we have a question there.
Good morning. Actually, it's not a question. I'm just commenting on what you just said. I'm just giving a comment. I'm a clinical educator in Almoosa. I'm just giving a comment on our journey to PTAP. Just to mention how can I say it? How Ms. Ghina, the manager of clinical educator, is really interesting to have the PTAP accreditation. We've really been through a lot. I learned a lot through the journey in the back 2 years back in my education. How can I call it? I became an educator 2 years back, so I've learned a lot. So when you are speaking about your journey in King Faisal through this PTAP accreditation, I can see it now. So it's really interesting to have this accreditation. So hopefully we'll get it, inshallah, with the help of
Thank you.
Thank you so much. Any more questions? Okay. Thank you. Dr. May.
Dr. John, in your program, did you think of collaborating with nursing schools, nursing colleges, and addressing the transition during the curriculum while they are studying in the college before they arrive to you as kind of postgraduate?
That is an absolutely fabulous question. I think within the kingdom we need to do a lot more collaboration. We already have very strong relationships with our academic partners. So for example, our academic partners come to the hospital on a regular basis. So what we did is share ideas with them. Within the hospital, we have faculty that have got strong backgrounds in curriculum, university experiences, but what we want to do is what we have done is shared with the university some of the challenges that new graduates face. So for example, when they come out of the university, there are certain clinical skills that we've noticed that some of the new graduates feel really worried about. So we've often talked about how can we improve that information going back into the curriculum. So King Saud University in Jeddah and King Abdulaziz, we have both deans on our oversight committee. So they're aware of how we develop, and they suggest to us maybe how we can develop in the future. That strong partnership, I think, as Dr. Sherry said, the academic community links are critical. As I said, they're involved in the program from a governance. We feedback on maybe every couple of months about how the program is going, so they actually do feedback, suggestions, and ideas. So as we go forward in the future, I think we want to strengthen some ways of working more closely, and that's what I would suggest. And I think it's a great idea. Institutions that are developing their practice transition programs, it's really important that data from the program is fed back to your curriculum, so you know how well you prepare the new graduates for the world of work and for their future. Thank you.
Yeah, I'll be interested in hearing a little bit more later of, for example, like the clinical skills you are looking for, the challenges you are facing, and what would you like to see in a new graduate coming to your transitional. While we are reviewing our curriculums and our regular reviews, we can look at those points and see if we are, addressing those points in our curriculum.
Yeah, that's a good suggestion. I mean, our new graduates come with some amazing skills, but there are certain, what we've noticed, using the Casey Fink research tool,
but there's certain skill areas that they feel really concerned about. And we've seen that consistently in every cohort, which is why in our work-based learning day, we do certain work with them, but also how we feed that back into the clinical areas with our preceptors, and we keep a close eye. So I'll be happy to share with you, no problem.
Great, thank you.
I think another thing that's really important as a nurse transitions from academia to practice is many times in our academic journeys, we are partnered one-on-one with the preceptor or with the clinical faculty member. And the moment that nurse receives their registration or their licensure, they now have the power to own their practice. And I think until they have that, I'm going to call it power to own their practice, despite however much preparation they've received, they still have that moment of uncertainty. And you have to live and breathe and be a nurse. Even if you had years and years of experience, it is going to still take time to transition autonomously and to practice to the full extension of your license in your country. So I think, Dr. May, I think you have wonderful opportunities to get your students to the brink of them becoming fully fledged nurses in the organizations, but they will experience that moment of transition, and it's a natural progression that every single one of us has definitely gone through in all of the transitions in our lives. So it's important to know that we can be prepared as much as possible, but there is that moment of, what more can I learn?
Just thinking, we know that there are different approaches to practice transition, different models, which is fantastic. We partner with colleagues in the community. We go out, we share our experiences. We get contacted from all over the kingdom, and we're really happy to share what we did, maybe what mistakes we made, and just create that amazing community within the kingdom to say collectively, we can really raise the bar here. We recognize that we have a duty in the community to share and support, and that's something that we do really successfully. I'm very happy. So if anybody wants to contact me, we're available, no problem.
Thank you so much. I have one last question for you. Just can you tell us how Magnet and PTAP are interrelated together?
So Magnet and Pathway are two of our credentialing programs, and by having an accredited residency or fellowship program, you receive credit for one of the standards, but that does not dismiss all of the other elements within that standard of where you also need to transition nurses from nurse to leader, from new nurse coming into your organization into being a nurse there. So it gives you credit, but not all of the credit, where I know the appraiser team for Magnet will validate that you've looked at all of those different transitions within your organization. But it does, I'm going to say, give you a pass or a moment of, you don't have to write to it, which I know leaders in the room are excited about, not writing to one of the elements. So that's one of the benefits.
Thank you so much. Thank you so much for this great panel. We learned a lot from your experience. Thank you so much.
We can now have a short break, then we'll meet after to continue our second panel. It's only 15 minutes break. Enjoy your meal.
motivates us all with his perseverance, accomplishment over the course of his career. So please join me in welcoming Dr. Abbas Al-Mutair to the stage.
Dr. Abbas Al-Mutair holds bachelor degree in nursing from University of Southern Queensland. He holds as well a master degree of nursing, PhD in medicine, nursing and health sciences from Monash University, Australia. Dr. Abbas is currently the Research Center Director and Chairman of Institutional Review Board at Almoosa Specialist Hospital. He is Associate Professor affiliated with Wollongong University, Australia, Princess Noura bint Abdul Rahman University, Prince Sultan Military College, and Almoosa College in Saudi Arabia. Furthermore, he authored and co-authored book chapters, and more than 160 research articles in Q1 and Q2 journals. His research interests include critical care, infectious diseases, education, training, cultural issues, statistics, and medical writings. He is an academic editor at PLOS ONE Journal and serving a number of highly reputed journals and as an editor and a reviewer. He has an experience of more than 20 years in nursing profession.
The stage is yours.
Thank you, Dina. Thank you very much. Thank you very much. Throughout my presentation, inshallah, I'll try to walk you through the research status, the nursing research status here in Saudi Arabia. But to overview the nursing research status here in Saudi Arabia, we'll have to go through the research profile of Saudi Arabia as well. So this is my interest, research and publication and journals and journal management. And I've been working on this for the last, I'll say, 10 years. And I love research, and it's actually my passion, and I do it on a daily basis. Well, sorry. So we don't have anything here. All right. So, well, in order to, as I mentioned to you, in order to cover the research status of nursing here in Saudi Arabia and how does it go, and the research profile of the nursing and the publications which is going out by nurses here in Saudi Arabia, I'll walk you through the G20, as Saudi Arabia is one of the G20, and they have a very nice report that they publish every year. It's being published by ISI, annual, they call it annual G20 scorecard, the research performance of 2022, and they do publish it every year. And they cover the research profile of Saudi Arabia and all of the countries of the G20. And then we will go through the research activities of, the nursing research activities in Saudi Arabia. And I did, for the purpose of this, presentation, I did a systematic review to examine the numbers, the characteristics of the research publication of PubMed cited articles, contributed from authors and co-authors from Saudi Arabia and internationally. And I did that between 2012 and 2022, for the last decade. And I also investigated the number of nursing publications as per year, study design, journal impact factor, and the international collaboration. Well, for the G20, for those who do not know the G20, as Saudi Arabia, as I mentioned earlier, that is one of the members of the G20. It represents 65% of the worldwide of the world population. Also, it produces 80% of the global GDP. Also, the G20, which consists of 19 countries, in addition to the European Union, they spend almost 93% of the global R&D, and they employs around 89% of the world's researchers. And we'll be able to know this throughout the report also. And they publish I mean, in terms of research and research performance, they publish almost 82% of the global research papers as per their report. Okay, this is a barcode of the annual report for 2022. If you are interested, you can read through it. As I mentioned to you earlier, it's produced by the ISI, the Institute for Scientific Information. It has all the research profiles of the G20 countries, including Saudi Arabia as well. Well, we always say that, we do have a lack of research, and key of successful in research is collaboration. Collaboration is key of successful, number one, in research. In order to increase the research output, we do have to collaborate with each other. I mean, I'm talking about collaboration nationally and internationally as well. So they have indicated this in their report, that they've mentioned, for example, in Saudi Arabia, more than 4/5 of output is now internationally collaborative, with the local output having more than doubled between 2018 to 2021. This leads to an impact well above world average if the collaboration is considered. And however, impact is around the world average. Open access output is strong in the most fields, and generally it tracks just above the G20 average. That's a good indication by the ISI report. And as I mentioned to you earlier, that collaboration is a key successful for research. I mean, to increase the research output among all the fields, including nursing as well. And the other point which they have indicated over here is the open access journals. We do have two types of journals. The first is the closed access journal, and the second is open access journals. We used to have almost 1 million, for example, output of research publication per year between 1996 until 2003. And then from 2004 until 2016, this number was doubled into 2.5 millions. Nowadays, we've reached to almost 16 million publications per year. Research publication per year. And this is due to collaboration as well as due to the open access. We do have so many open access journals, and the review process is the same in the open access and the closed access. However, the average of publications in the closed access takes up to about 270 days, while it takes up to 4 weeks sometimes, or 6 weeks in open access journals. Well, again, collaboration international is an increasingly common trait for academic research since 1980s. I've just mentioned that. And collaboration can transfer access and equipment and finance as well, and tackle global scale issues such as pandemic. And we have, such as COVID-19, for example. And we have, been through the pandemic, the COVID-19, and we have seen, the total, the tremendous number of publications during the pandemic, and it's due to actually collaboration. We work in the clinical areas, and we work in the research, and we do have so many, we come across so many international studies that are being conducted all over the world, or in multiple countries, including, for example, Saudi Arabia, where they approach us to conduct a study in. For example, in one of the centers. So some of the leading nations in terms of scientific publishing, like the G20, with their established research economy, represents a favorable partners for other nations to see collaboration with. And over 2 pages, they, in the report, they use statistics to report or to indicate, utilizing numbers and frequencies and percentage, as well as some statistics and graphs and tables, in order to overview the research output or the research profile of each country. And here's the research profile of Saudi Arabia, where they indicate, the output of the collaboration, the output of the open access, the total number of, say, for example, the total number of the researchers, active researchers in the kingdom, as well as the output per field, including medical field. There is nothing, as nursing is part of the medical field, including medical field, and also the output by discipline itself. And actually, the numbers are quite good if we look at it. I mean, and the graphs and the statistics is quite good, especially if we compare it with the other like countries. We do live actually on the, I mean, towards achieving the 2030 vision. And one of the most important parameters, one of the most important themes of 2030 vision is research, and concentrating on research and innovation. And back in March 2021, the higher committee for research, development, and innovation which is linked to the Council of Economic and Development Affairs was established, and it looks after the innovation and development and research, and looking after research and supporting research as well here in the Kingdom of Saudi Arabia. Now, in 2020, for example, among the G20 countries, according to the report itself, there were like more than 3 million patents, and Saudi Arabia was ranked the 10th, as you can see over here. This doesn't work. Okay, so in terms of population, Saudi Arabia was ranked 18. In terms of patents, I mean, the total number of patents which were registered in Saudi Arabia were more than 6,000. Okay, were more than 6,000, and also it was ranked the 12th in terms of the patents per population. And actually, the rank was a bit better in 2021, where Saudi Arabia was ranked 11 in terms of patent per population. Well, if we talk about publications, as I mentioned to you earlier, that we do have more than 15 or 16 millions of publication per year. I mean, scientific publication per year, and documents being like recorded. So Saudi Arabia was ranked also the 10th in terms of, the total number of scientific research output coming out of the country, with more than 119,000 publication in 2020. To this number also was increased, and placing it at the same rank, the 10th, with a total of 143 or more than 143 publication in 2021. We have gone through the pandemic, as I mentioned to you earlier, and there were so many publications, and it was actually a very good time or a period of research publication during the pandemic. Myself, I benefited from this, and we've published so many articles due to the pandemic. And they have, we used to have so many publications. There is a record that more than 200 publications by December 2020 were out. And Saudi Arabia was ranked the first regionally and the 17th globally in the coronavirus research. And this counts actually for 1.8 of the total publications in coronavirus. A global research production. And this, among this 1.8%, a total of 83.4% of the kingdom was, production related to the universities. The universities produced those sort of, COVID-19 research-related articles. Well, towards the nursing, or the, in order for me to determine and evaluate the current state of the research output here in Saudi Arabia, I did a systematic review, for the sake of this presentation. So I wanted to examine the numbers, or the total numbers of, and the characteristics of the PubMed cited nursing research articles contributed from Saudi Arabia as a product of collaboration or without collaboration. And I did this between 2012 and 2022, the last 10 years. And I also investigated the number of publication as per the specialty, as per the year, the study design, and the journal impact factor, and the international collaboration, if there is any international collaboration due to this publication. So I included all the studies between 2012 to to 2022, and I excluded the other periods, before this and after it. And also, I included only the English language, and also the research location, which was conducted in Saudi Arabia, and also I included the Saudi authors. So in terms of the keywords, I used Kingdom Saudi Arabia, nursing, nurses. Also, I determined the articles through reviewing the evaluations and the titles and the abstracts of each and every article, which was included in the systematic review. And I classified them actually to, articles which came out from Saudi Arabia and articles which came out of as a sort of, or as a product of international collaborations. And also, I classified them if they belong to nursing articles or multidisciplinary articles. And I also classified them according to the field, whether they are clinical practice, if the study was related to clinical, or an academic if it's related to the management or any kind of education. Nursing education, or or any type of social topics. Right. So, and I also collected the information related to the study design, the impact factor, and the specialty, as I mentioned to you. Now, this is the table that I came up with, or the results that I came up with throughout the systematic review. It's quite a small number of publications. Research outcome publication by nurses, mainly in Google Scholar, and this is anticipated actually because Google Scholar, it includes indexed and non-indexed journals, while PubMed has restrictions to include journals, and CINAHL has also more restrictions to include journals, as it belongs to nursing only. So there were quite a few publications came out throughout. If we're talking about 10 years. Well, in terms of the country, mainly they were from Saudi Arabia. In terms of the academic or clinics, they were similar in percentage if we classify them into clinical practice research or academic. And also mainly the studies were review studies, or if we take into this into account observational studies, including cross-sectional studies. But there were a few studies, interventional studies, or qualitative, or utilizing triangulation designs. Well, in terms of impact factor, a total of 177 journals of 269 journals had impact factor, and the rest didn't have an impact factor. And the median of the impact factor was around 1.6, plus or minus. And this is anticipated because the highest impact factor of nursing journal is 5. And in terms of also Q1 to Q4, it was about 0.5. Now, the publication numbers of nursing is low and needs to be maximized. As I mentioned to you, that this can be done through collaboration. Collaboration is a key successful for research. And also, as an example, nurses who works in the clinical area are quite busy, and they don't have to conduct research, and they are not academically trained to conduct research. However, the academicians, for example, so those who work in the academia, they do have the time and they do have the training, but they don't have a patient to flow. So if they can collaborate with each other, then they can increase the number of research output. The impact profile reflects a policy orientation towards international collaboration, and most of the published papers are domestic. And also the domestic research has not yet seen the benefits of the investments, especially if we're talking about the 2030 vision, and research is one of the most important themes, research and innovation. And research input as well as impact by the nursing discipline needs to be improved. And this can be done through increasing the data generation in order to utilize it for research, also access to life pertaining medicines, and also a clinical or training and development of nurses in order for them to conduct research. This was my time, and thank you very much. Thank you. All right. I'll moderate this session. So, okay. There we go. All right. I would like to. Thank you very much. I would like to welcome Dr. Amin Al-Marzougi. Does this work? Okay. I'd like to welcome Dr. Amin Al-Marzougi. Dr. Amin is an assistant chancellor for branches affairs at the University of Sharjah. Dr. Amin is also the acting dean, College of Health Sciences, University of Sharjah, and assistant dean, University of Sharjah College of Health Sciences. She received her Bachelor of Science in Community Health Education in 1985 from University of Southern Carolina, Columbia, USA. In 1988, she received her master's degree in health management, planning and policy from the Nuffield Institute, Leeds University, UK. Afterwards, she received her high diploma in healthcare management and planning from the Institute of Public Health from Alexandria University, Egypt in 1994. In 2000, also she had her PhD in public health in healthcare management and planning from the Institute of Public Health, Alexandria University, Egypt. She also received an EFQM certificate from the College of Quality, Dubai in 2013. Dr. Amina, inshallah, will talk about the closing the gap between education and practice. Please welcome Dr. Amina.
Thank you very much, Dr. Abbas. Allow me to just really express my gratitudes and my thanks to the Almoosa Specialist Hospital leaders, CEO and his team, and the organizer of this marvelous and really amazing conference, first conference. So it's really a pleasure to be with you and sharing some of my thoughts and some of the steps that at the University of Sharjah we are really trying to upgrade and enhance the quality of the outcomes of the university as graduate nursing students going into the practice. Before I start, I would like really to share that we have really to acknowledge always our Muslim nurses, that they were pioneers in achieving a lot in an era where, like 1400 years ago or more, with very limited resources. They've been achievers, nurses in the battlefields, supporting Rasul alayhi salatu salam and the people that they were injured and needed the care. And we come back to the Western Florence Nightingale, the Lady of the Lamb, with her also achieving in the nursing profession. She was conducting research since then. And she's the first lady that she's introducing the documentation, statistics, and the data. That's magnet. So this is nursing. It's a profession of noble. And this era, we have an outstanding examples like Fatma and Dina and Nicole, and everybody stepped on this stage this morning. And I felt really this is not only an achievement to the Almoosa, it's a hospital, or even to Al-Hassa or to Saudi Arabia. It's an achievement to the nursing profession around the world. Because these nurses that really they are sacrificing times and efforts and providing care before they introduce cure to the patients. they also suffer. And I personally, sometimes when I feel like I'm burned out and stressed from work, at night I go outside and look at the sky. This dark sky will not be benefit to see the shining stars. So this is really the life. We are sacrificing, and always I say nursing profession, it's really the profession of caring. It is also a profession of leadership. And nurses, they know how to do things right and at the right time because they are saving lives. So you should be proud of yourself that you are in this profession. Can we start? So, as I said, the nursing, it's really a profession of leadership, management, and giving care. But we face some challenges, and we try to solve these challenges by doing things that in the correct way to benefit our graduates as an input to the industry and to the services. And by that, we are really not eliminating the challenges, but we convert them into opportunities. And this is when we say the way forward. Yesterday, Janet, she was stressing the future, and I would say the future is today. Nursing went through a lot of challenges and around the world, and we are part of the world. And this is really not only in the UAE, but the whole GCC. We suffered from these things for a while. So nursing started as a profession on practice. Nurses, they were trained in the hospitals. We didn't have schools to train nurses. And they started initiating this by themselves. They go to the school and they volunteer and they help patients. Then we, in 1970s, we started establishing our nursing education, and Dr. Fatma yesterday, she elaborated on that. And also with her and her team, we could really eliminate the diploma graduates through the bridging program, and really we achieved a lot. Today we don't have many of the students in the bridging because many of them, they attain the bachelor degree in nursing. During this time also we had these assistant nurses and the helpers that they are non-professionals, but the non-nursing services and activities, they really ruined the image of the nursing, because nurses, they were doing a lot of things that they are really not related, but they are doing it because they feel they need to do the job. So image of the nursing were affected at that time. And the other challenge is also male to female ratio. And that was really a big challenge in many of the hospitals. Leadership at the UAE at that time and the decision making, it wasn't really presented at the national level until 1990s, where established the Department of Nursing at the Ministry of Health. We had, because we used to have the large number or the large percentage of the nurses coming from abroad and from non-Arab speaker countries, and that really affecting the quality of services in terms of the cultural barriers and the language barriers. And at that time, we didn't really have that much of the inclusion and the cultural diversity within our system to appreciate what these nurses are doing and include them within the system. At the same time, we upgrade the nationalization in the nursing. The gap between the education and the clinical practice, really, it's an urgent issue in our region. And we need really to close that gap by raising the quality and preparing our graduates for the services where when they go and for a hospital had an accreditation, magnet, or any type of accreditation, they can add value and they can be of a benefit. Preceptorship versus the clinical tutor. That's another challenge because the nurses in the hospitals, they have their own challenges as well. The time, the workload, and all of these things that they don't have time to pay attention to the students. So we recruited our clinical tutors to support them, but also we had some of the challenges of that because our clinical tutors, they have really to spend a lot of time with our nurses in the hospitals. As I said at the beginning, the number of the enrollment in the BS program was really low and going slowly, but really getting better, and it's booming for this year in many of the nursing schools and colleges at the UAE because of the COVID. That's one of the positive things that COVID brought to the profession, that nurses, they were more valued in the services, and about what they are doing and how they sacrifice their time and their efforts to make patients really survive. As I said, we started the bachelor and we tried really to get closer to the services. So we are involved in this national strategic plan for the nursing, and we have that at the level of the UAE. Also, we, as Fatma said yesterday, that we established our nursing professional association. And also we have the privilege to have our UAE Nursing and Midwifery Council in 2006, aiming to standardize the practice, registration and licensing and education, and prioritize the national nursing and midwifery research agenda. So all of these strong steps and achievements that we have really brought the nursing into the recognition. And to close this gap really and enhance the quality of nursing, as you are working on magnet and any, all these types of the accreditation, we really thought about, why we look into our outcomes as an input into the service. So we have to sound to their level and their achievements and make these graduates of a value. So the outcomes of the nursing schools is the input to the operational or services, providing facilities like hospitals and health centers. So we accomplished the framework development and accreditation for nursing education, and this is for the UAE, reviewing all the frameworks that we've been using before around the world, and we included all the nursing colleges at the level of the UAE. So we unified them at the level of the schools for the education. Also, we involved the Ministry of Education, the CAA, the Commission for Accreditation, because they will be reviewing and including this in their accreditation when they come to our schools. So we established 7 domains: community and public health, patient-centered care, professional, ethical, and legal practice, safety and quality of care, leadership and management, informatics and technology, communication and collaboration. I will just elaborate on these are the competencies standards that we published. And we wanted really to have the criteria for each domain. And these are the criteria. In the community, we learned the lesson that public health is really an important, very essential approach, not only for the community nurse, but also for the hospital nurses. And we all know what we faced with the COVID during that pandemic time. So nurses, they have really to focus also on their education, on the health education, prevention, promotion, ill prevention, and community-based practice, because they will need it. We don't know what will happen next. Another thing is the patient-centered care, as we said, knowledge integration, holistic, safe care, patient care. Nurses, they are the advocates of the patients, and we witnessed this morning with all the nurses that they were really close to the patients, just to be like their advocates to any other professional in the hospital. Care transition and continuity, because many hospitals, by the time the patient will leave, there is no continuity of, seeing or checking on that patient in the home visits or any type of consultation. Therapeutic intervention and problem solving and critical thinking. We are integrating all of these criteria within the curriculum of nursing, so they will get the comprehensive information and knowledge and competency. Ethical, legal, and professionalism, ethical and moral practice, legal practice, accountability, professional development, and cultural competency. Also, the safety and quality of care, risk management, nursing research and evidence-based practice, and also our college is the member in the national evidence research practice at the practice and research at the national level. Clinical reasoning and judgment, and quality management and improvement. Also leadership and management, and we know that, as I said, nursing really, they are very strong being leaders, not only at the top level, but even the nurse, the bed nurse beside the patient, she's a leader and she's a decision maker for the treatment and the care given to the patient. Communication and collaboration, and this is also the effective communication, the effective therapeutic relationship, the interdisciplinary. And I want really just to stop a minute in the interdisciplinary approach or communication. Actually, I did a research, I published it recently, to see how the team at the level of the hospital, they can be together to talk about one patient and the need of that one patient. We need this type of the approach and exercise to be in our hospitals. Don't go vertical nursing, please. Just be horizontal. You are all over the hospital, by the way. So I think the interdisciplinary, we started at the level of the education. Why we are doing this? Because this is the future of any science. Today, the business and the medical and the engineer and the science, they all include the entrepreneurship within their program. Not necessarily that I graduate and work at the government. It's not necessarily. And when we talk about employability and you have your chance to be your own business, you own your own business, that's really when you have to integrate and study at the level of the college or university many sciences or courses that are preparing, qualifying the graduates to do by their own. Of course, at the College of Health Sciences, we have physiotherapy, we have clinical nutrition programs, we have laboratory sciences, we have imaging. So really, we are preparing all of these graduates to have their own business in the future. So this kind of the interdisciplinary at the level of the education. And when it comes to the practice in the hospital, we always look at the teamwork, how you can work as, with the physician, with the technologists, either for imaging or in the lab or in the nuclear medicine or in the pharmacy or wherever. So this type of speaking the same language and aiming to enhance the care of the patients, this is what we are looking for. Communication and collaboration has been really emphasized since yesterday, that this kind of the effective communication, sometimes many of the management problems, when we look at it and we just go deep and looking what was the problem. Sometimes it's a communication. So this is really very important, to think about the importance of the communication and collaboration and the interdisciplinary. Informatics technology, health information management. This is the documentation you are working for and the data and the statistic that you need for your magnet. Introducing the technology within the electronic documentation. It needs really the nurses to know all of these kind of the practices needed. Innovation and entrepreneurship, this is what I said. Today, if you want really to enhance the education of nursing, you have to open to the world. Through the telecommunication or telehealth, you can really go in an open heart surgery, operation theater in the States or in Australia or in UK or wherever. And you can learn the best practice and you benchmark your services with these kind of things without moving from the country. So we have really to emphasize that the process of implementation of these framework that I'm mentioning, after we define them and we state all the criteria, we have to assess the level of achievements and the competency assessment tool and stated the indicators of achievement. Actually, we are planning to start this by next year after we train all our instructors and faculties for this approach, bearing in mind that also we will include the services, preceptors and others, to be part of this. Opportunities and solutions also for all of these kind of challenges we are facing in the education of nursing and nursing profession as well is the change. Change, as much as we all emphasize and we want, it is very scary word for many of the people. This concept is really scaring many people that they don't want to change. So it is a challenge, but we have really to convert it into opportunity. Link the education with services through the regulation. So we have to know what are the professional requirements, what are the promotion requirements, and all of these kind of principles that will enhance and strengthen our graduates. Competency of nursing practice and advanced technology and innovation. We have really I know that many of the colleges, they are equipped with the simulation labs and technology and emphasizing research with AI and so on. But we have really also to assess this stage of introducing all of these things and see how we can have that kind of the competency reflected on our graduation. Quality of nursing education and practice through accreditation, like what you are doing, Magnet and other excellence programs, and the competency of the clinical training. We conduct a lot of mentorship, workshops, training, orientation to our preceptors, so they will be online with our students during their clinical training. The way forward, as I said, to me, the future is today. And excellence and the quality of nursing care has to be through the very strong and very ambitious continuous professional development, evidence-based research. We emphasize the clinical and applicable research that will really sound positive to the community and to the industry. Standardization of both education and practice, nationalization, and really we don't want only to do the nationalization, as we have really also to implement the succession plan. And I believe that nurses, they have to be strong, they have to be young, they have to be active. So this kind of action has really to be looked at and planned very well, and increase the number of male students, because this is really some of the hospitals, they are suffering, and we don't want really to put more pressure on our female nurses. So this is really what I wanted to share with you. I have a plane to catch, So if you have any questions.
Thank you
because I
very
cannot
much. We know
stay.
that Dr. Amina has a flight to catch, so we have time to have like a couple of questions, then we can like proceed.
Okay.
Is there, if there is a question from the audience? Well, Dr. Amina, now in terms of closing the gap between academia and the clinic. Now, the academia sometimes they live in an island, and in the clinics they live in another island, and they are like totally separated from each other. Do you think that including, for example, the clinicians in teaching and decision making of, the academic institution and an advisory board, for example, can close this gap and sort out this issue? And what like initiatives that you have done in Sharjah University, for example, to sort it out?
Actually, really, you have to be close to your industry in many aspects. If you really look at your graduates after 4 or 5 years from the day when they join the university, you need to see your outcomes really, it's growing there. So employability is one of the, I wouldn't say challenge, but it is really working well, especially after the COVID. They cannot sacrifice not recruiting any of the nursing. So clinical training, actually, it's also the limited number of hospitals and the large number of students. It's been starting, having that kind of the, problem of where we will train our students. Actually, at the University of Sharjah, we empower our students at the simulation labs and wet and dry labs within the school. And then when they go to the practice, they will be ready to practice. So that's really, but by the new rule of the Minister of Education, the CA, that they increased the clinical hours from 1,300 to 1,600. So that's also this kind of increase, really it's affecting the clinical practice, sites within the Sharjah. But we are opening to the private hospitals also and semi-government hospitals. You have really to have a memorandum of understanding with your stakeholders and with your industry organizations. And you have really to state the terms that they will strengthen your program and closing a gap in research, in training, in education, in all of these aspects that will strengthen both sides.
Thank you very much.
Sure.
So, yeah, we have another question. No? Okay, thank you very much. I would like to call our CEO and Ms. Hera also to honor our keynote speaker, please. Thank you very much. Now we shall move to our next speaker, Prof. Annie Mary, Professor of Health and Nursing Policy at King's College London, the Florence Nightingale Faculty of Nursing, Midwifery and Palliative Care. Annie is a historian, health services and policy researcher, is the first nurse to receive a doctorate from the University of Oxford. She is the recipient of many awards, including being nominated as one of the 70 most influential nurses in the 70 years of the UK National Health Service in 2018. She was in the top 100 clinical leaders recognized by the Health Services Journal in 2016 and made being commander of the British Empire by Her Majesty the Queen for services to nursing in 2020. Please welcome Prof. Annie Mary on stage.
Good afternoon, everyone. I'm absolutely thrilled to be part of this conference, although regrettably cannot be there in person. But I just want to thank your chief nurse, Miss Hera, as you call her, and all of the organisers behind the scenes who've helped to bring this conference to fruition. And I'm especially sorry to miss the fun night last night. So I hope it was very successful and you all had a great time. But today I'm going to follow on and articulate some of my comments with the presentations that you've already heard on Magnet and really build a business case for investment in nursing excellence and innovation. And as you can see, I'm from King's College London and sending greetings from Westminster Bridge here, which leads to our Parliament and, you know, that powerhouse that we all try to influence in nursing policy terms in this country. So I want to also thank colleagues who've been an inspiration to me and whose work I'm also drawing on, but have also had the great privilege of participating in. And these are the acknowledgements also for the grants that we've received upon which this work is actually based. So my presentation will cover three main areas. I want to first of all give you a flavour of some of the evidence on workforce dynamics and its impacts on patient outcomes that I've been involved in for over 20 years, more than that actually, and working with the world-renowned Linda Aitken and her team, and Walter Sermoos from Belgium, Linda Aitken's from the University of Pennsylvania. A look at the business case for investment in nursing excellence and introduce to you a new study that we're actually undertaking, which takes the Magnet model one step further, but links to the business case for nursing innovation in terms of delivering, we hope, organisational outcomes that will impact staff well-being. And that, again, will be a return benefit on the investment that we see in nurse staffing. So the great tradition of Florence Nightingale in measuring patient outcomes and that type of health services research is something that our work really builds upon. She was obviously a pioneer in this area and a great influencer of policy at parliamentary and other levels, and she's the patron saint of our faculty, I'm very proud to say. Our school and faculty is the direct descendant of the original Nightingale Training School at St Thomas's Hospital, which opened in 1860. And the first study, though, to demonstrate an impact and a relationship between nurse staffing and patient outcomes actually originated from our faculty, and I was a principal investigator on this study, and we found many of the similar findings that had been previously discovered in North American studies, i.e. that nurse staffing numbers actually influenced whether patients lived or died in terms of their mortality rates, but they had impacts on nurses themselves in terms of their job satisfaction, their emotional exhaustion, and their burnout rates. And what we also showed in that predecessor study to the large European study, RN Forecast, which looked at some of these relationships across 12 countries in Europe, was that there was great variation, even in similarly organised units in hospitals within the National Health Service in England. There was great variation, which could not be explained by the actual type of clinical conditions that patients actually had. So it was not the dependency or acuity of patients or the clinical profile that was driving these outcomes. There were clearly allocative and resource decisions that would be taken at local level, but these had very material impacts on patients' survival. And that, I think, is illustrated as well by further research that we undertook and published in the Lancet in 2014, where you see that nurse staffing along the bottom axis and the outcomes on the top axis varied according to staffing levels. And our calculation was, in modelling these data, that if you added one patient to an RN's workload, that it resulted in a 7% increase in deaths after common surgery, and every 10% in bachelor's education gave you an added benefit of reducing mortality by that same 7%. Because this paper, we also demonstrated that education of nurses to degree level was another protective factor that actually helped patients survive their stay in hospital. And we reckoned that if all hospitals in the countries we investigated could staff to the level of 60% bachelor's levels and control the workload to 1 to 6, you could save 3,500 patient lives per year. So that's quite a significant finding. But there have been many other experiments in trying to vary and standardise staffing. That is, vary the ratio so that it's standardised. And the first country to do this, or state to do this, was in California. And basically in California, it was demonstrated that when nurse-to-patient ratios were introduced, they had significant benefits in terms of mortality. And that was not something which was a short-term benefit. That has stood the test of time. And now, over 15 years later, it still remains a positive benefit of that level of investment. Then California was followed by Victoria in 2000. Sorry, I got those round the wrong way. It was Victoria that pioneered this, and then California followed suit. And then Queensland in 2019 actually did a before and after study where there was an evaluation of the impact of ratios in Australia, and they found positive benefits, which I'll just explain a little further. We have also had some legislation in Wales and Scotland and a pilot in Ireland which showed significant benefits. But in Wales and Scotland, we haven't had a formal evaluation, so that's yet to be done. And unfortunately, it's too late to do a pre and post. But hopefully, when we get legislation in England, which is an outlier at the moment, then we will be able to do a before and after evaluation. So essentially, the argument, I think, which is pretty robust, demonstrates that we can improve quality and patient outcomes by standardising nurse-to-patient ratios. It also has the added benefit of improving the recruitment and the retention of nurses, which provides in itself cost savings. And some countries have actually accomplished this without having a significant uplift in their budgets through an unfunded mandate. And 1 year after the implementation of the Queensland ratios, there are many-fold benefits in terms of infection prevention, patient safety, and missed care, which is another way in which care is actually rationed in systems, and in nurse benefits as well, in terms of job satisfaction and burnout. So we can see that better staffing leads to better nurse patient satisfaction, as well as nurse satisfaction. And actually, that's very important for the National Health Service, for example, where patient satisfaction is an important predictor of relatives also recommending their hospital. So the competitive status of that hospital. But in addition, it's a marker of the confidence that the public actually have in the National Health Service itself. So it's a very strong argument to governments that investment in nurse staffing produces direct and indirect benefits that will improve and boost the confidence of the public in the National Health Service, which is a major political issue that we are facing at this moment, because we have strikes in our country, and some going to begin again this week, of nurses who are so deeply distressed and dissatisfied at their working conditions, of which staffing is a major part. And sometimes when we're faced with shortages on the scale that we've seen globally, I mean, we have short globally of over 6 million nurses, as the WHO State of the World's Nursing Report demonstrated in 2020. That's 6 out of 29 million, which is about 12% of the world's workforce is missing. That sometimes the temptation is for policymakers to actually dilute the skill mix with lesser skilled workers, and our research has demonstrated that that is not a cost-effective way to proceed, that actually introduces extra harms into the system. And a new paper that we published last year actually demonstrates the necessity of investing in more highly skilled staff who provide a leadership function that not only supports those more junior staff, but which adds to the benefit in terms of patient outcomes and mortality. So a senior nurse, such as a matron, helps to deliver almost double the benefit in patient mortality. This is a new finding, really, internationally, than an RN. So essentially, that is demonstrating that investment in senior leadership, and I would argue resource management and risk management decisions that those nurses are taking, provides a protective value that outstrips any argument to begin diluting the skill mix. And we found that when we looked at assistive personnel, healthcare support workers, for example, that when the skill mix was changed, again, this is a repeat finding from other studies, that they do not produce, there are no substitutes for registered nurses. And also within our system, when we are short-staffed, we tend to employ nurses from temporary staffing agencies. We also found, and this is again a first, that those nurses do not substitute for our stable team members who are registered nurses. So this is all about the value and return of investment for patients in investing in more highly qualified and senior and skilled staff. So as I've just really, this is basically another kind of shorthand summary, short staffing costs lives, the impacts are bigger for registered nurses directly employed by our organisations, and senior nurses are particularly important. And problems start to emerge when more than one registered nurse is actually missing from the team. And how we did this was we looked at deviations from the target level of staffing on a ward, and we differentiate between different types of skilled workers. And basically, we compared patient outcomes on days when a ward had higher staffing levels to other days when the same ward had lower staffing levels, and our main outcome was patient mortality. So that is an interesting paper for you to read, and I think it reinforces but builds on and extends some of the evidence. So I guess the main point of this is that actually nurses are assets and not costs in the system, because nursing is a safety critical profession, and it's the most protective probably shield that patients have from harm, and that's, I think, been well evidenced. But building a business case needs also a strategic and organisational plan in order to mobilise, in order to give the yield, if you like, provide the yield from that investment. So it's about really, as a kind of developing the business case as a strategic tool for change and a rationale, and aligning it with other strategic priorities within the organisation. It's not something that can happen on its own, so it's got to be adding value to other interventions. And just to introduce you to this study, Magnet for Europe, there's a website that you can consult as well on this. There's a major, probably the largest trial that's ever been undertaken in nursing. We're twinning essentially 69 hospitals in Europe with American counterparts. And this twinning partnership is kind of providing a coaching platform to help hospitals in Europe improve their outcomes, improve their alignment with the Magnet model, professional practice model, shared governance, you'll be very familiar with. So that is happening in a crossover trial design, and we're getting to a very exciting phase in that, where we're actually beginning to get some results. It's a very large study. I'm not going to go through all of the partners, and it's here are some of the, you can have the slides afterwards, in 6 different countries, and it's really trying to amplify the ingredients of Magnet hospitals and see if they're transferable to a different context of Europe. Now, I know that you've got Magnet Hospital, maybe even plural, in Saudi, so you're familiar with this model and its transferability. So that would be very interesting to talk about and compare. And these are our outcomes. We're looking specifically, given the crisis in mental health of healthcare workers after the pandemic. That's one of our major targets for impact, is does it also improve mental health and well-being of doctors and nurses? And it's the first study, I think, to also include doctors in within its reach and its remit. So that in itself, because we know the fallout of mental health problems is going to trigger further retention and recruitment problems, that's something that we have got to really intervene in and try to enhance. And if that can be helped by the quality improvement measures that are part and parcel of the Magnet practice model, then I think that will also foster an improvement in outcomes, but also benefits for patients and staff, and the return on staff investment. So basically, what I've been arguing is that investing in staff does deliver better outcomes. And by doing so, it's cost savings because you're preventing readmissions and all of those complications. And it makes, these environments better places to work, improves recruitment and retention costs of staff, which are very significant given staffing is the biggest cost of a hospital. Investment is, and I think this is a new thing, also needs to include senior nurse leadership to improve the decision making. I think the risk and resource management decisions that those staff also are empowered and have the authority to make. And thirdly, that the return on investment delivers dividends in terms of the health and well-being, which increasingly staff are actually looking for as a benefit. And an important protective mechanism to build resilience, innovation, and financial competitiveness for the future. And that's what our health system will rely upon. So thank you so much for your attention, and very happy if we can to take any questions.
Thank you very much, Prof. Mary, for your rich and informative talk. We shall proceed with the next speaker, Dr. Joel. Dr. Joel Ray. Mr. Ray has over 40 years of nursing experience. He is currently the President of Culture Care Consulting LLC and Chief Clinical Advisor at Loedo. Previously, he was the Vice President of Patient Care Service and Chief Nursing Officer at UNC Healthcare. While under his guidance, the hospital received its fourth designation of magnet status, CMS 5-star, and a rating as and was recognized by the re-gional.org among the top hospitals in the country for nurses to work. Mr. Ray has served 26 years in the United States Air Force Nurse Corps, retiring with the rank of colonel. Board experience includes 3 years as a member of the United States Air Force Nurse Corps, Board of Directors, Executive Board of the Allies, I'm pronouncing it very well, Center for Health Education, and Chairperson for the HEROM Chief Nurse Executive Advisory Board. He is a member of the American Organization of Nurse Leaders and published contributor to nursing and other health care journals. He is a recipient of numerous military awards and decorations, has received the Triangle Business Journal Healthcare Here Award and Veterans Award in 2018. Mr. Ray earned his BSN from Arkansas State University and MSN from Arizona State University. He holds Nurse Executive Advanced Board certification by the American Nursing Credentialing Center. Welcome.
Thank you so much. Well, congratulations on a fantastic conference. I hope that you're having trouble containing your pride because you absolutely deserve it. It has just been a phenomenal 2 days, and I'm so humbled and grateful to have this opportunity to be a part of it. Hera, thank you for reaching out to me and including me. The auspicious and renowned leadership that has been present and presenting from across the globe the last couple of days. I'm just so honored to be a part of it. And I'm so excited to be talking to you about something that I'm extremely passionate about: patient experience, translating caring theory into our practice each day. And as I toured the Almoosa Hospital a couple of days ago, I saw your compassion and your competence in every unit that I visited. The compassion and competence that you showed one another and that translated to your patients. I know it's important to you, and I'm so excited to have this discussion with you. And so why is it important to us? It's part of our journey to become a high reliability organization. We want to consistently give safe, high quality, patient-centered care. And how do we do that? Part of it is creating an exceptional patient experience every time. And that is undergirded by developing caring relationships with our patients so that our patients know that we care about them as we care as much about them as people as we care for them as our patients. I had the privilege of working with Dr. Kristen Swanson, a world-renowned caring theorist. She was at the University of North Carolina in 2008 when I joined the organization. Her caring theory really became what undergirded our work that we wanted to do in elevating our patient experience. We found that we had opportunities to improve, and we wanted to ensure that it was evidence-based and grounded in caring theory. So a wonderful academic and hospital partnership began. Swanson defines nursing as a caring way of caring is a nurturing way of relating to a valued other to whom one feels a sense of personal responsibility and commitment. And I think about that is really a wonderful definition of relationship-based care. And I tell you, Bonnie, what comes to my mind when I see that is the Daisy statue and that intimate relationship that it signifies between a nurse and their patients. So how do we build that caring relationship? Swanson identified 5 caring processes that when we demonstrate them and integrate them into our care, they promote the well-being of our patients. The first are knowing and being with. When we work to ensure that we're knowing our patients as individuals, that we're focusing on really having a presence with them, our patients see us as compassionate caregivers. And then enabling and doing for, as we work to prepare our patients to care for themselves, as we bring to our care our clinical competence, our patients see us as competent caregivers. And running through all of that is maintaining belief to promote the well-being of our patients. Swanson stated that the essence of caring is maintaining belief in the personhood of another and their ability to achieve their maximum state of well-being. It is anchored in knowing, conveyed through being with, and enacted through doing for and enabling. So I want us to look a little more closely at each one of these caring processes. Knowing a patient is really trying to understand an event as it has meaning in the life of that patient. We never want to assume, and I saw your busy OR schedule for Saturday, that our first patient of the day and the last patient of the day, that their perceptions around their experience are anything alike, even though they may be having very similar procedures. So how do we do that? Swanson's theory proposes that we integrate these subdimensional behaviors that make visible our caring to our patients. So we always want to make sure that we're centering on the patient, that we're seeking cues about their verbal and nonverbal presentation, their level of anxiety, fear, or their comfort with what's happening. We want to make sure that we're avoiding assumptions and that we're assessing them thoroughly. And when we do that, we're exercising that caring process of knowing, and our patients see us as compassionate caregivers. Being with is not only being physically present with our patients, but being emotionally present with them as well. And I've been a nurse 41 years, and there is more technology in a patient's room than there has ever been in any time in my history. And so many areas across the world are having trouble with nurses walking into a patient's room and they're addressing the monitor and the beeping pumps, and they're never really taking the time to have the discipline of focusing on the patient. Each time we enter a patient's room, we want to make sure that we are focused on them, that we're being fully present, that we're conveying our availability, that we're letting them know we're going to endure with them through whatever this clinical condition or pain that they're experiencing is, allowing them to share their feelings and developing that caring, connected relationship and conveying that compassion. Knowing and being with convey the caring attribute of compassion. And these subdimensional behaviors integrated in our daily practice make that visible to each of our patients. Doing for is doing what our patients would do for themselves if they were able, but they don't have the clinical competence and capability that you share. And so you bring that clinical competence and you offer that as caring to your patients. So all those things that you do to make sure that you're administering your medication safely, delivering complex dressing changes and IV therapy. As you perform those skillfully, as you comfort and anticipate your patient's needs, as you protect them from harm while they're hospitalized and preserve their dignity, you're showing that caring process of doing for, and our patients see us as competent caregivers when we do so. Enabling is facilitating the passage of one through life events and transitions. I simply think of it in our hospital as enabling our patients to care for themselves when they go home and they're no longer in our care. All that we do in terms of our patient education, informing, explaining, validating, and making sure that they understand the education that we've given, helping them to develop and generate alternatives that may need to be different in their life now that they have this clinical condition. That is enabling our patients and helping them to achieve greater independence. So the caring process of doing for and enabling conveys that caring attribute of clinical competence, and we can integrate it into our practice much more richly as we focus on these subdimensional behaviors that convey the caring process of competence. Maintaining belief is that sustaining faith in another's capacity to get through an event or transition and face a life with a meaningful future. You know, when our patients are admitted to us and they're diagnosed with cancer or diabetes or peripheral vascular disease, their life is maybe very different from this point forward than what it was. And that is a significant moment for them. And so as nurses, we have the opportunity to give them hope, to be hope-filled in our conversations, to be realistic in terms of optimism about the changes that may have to be made, but also ensuring them that we're going to go the distance with them through whatever clinical condition it is that they face. Maintaining belief conveys both compassion and competence and truly promotes the well-being of our patients. Each of these 5 caring processes are so important in making our caring visible to our patients as we integrate them into our daily practice. And they promote and inspire the well-being of our patients. Swanson's theory proposes that as our patients experience these caring processes, it facilitates a positive sentiment and response that promotes their well-being. When we take the time to show our patients that we want to know them as a patient and an individual and as a person, they feel understood. When they see us having the discipline to be focused on them when we're in the room, they feel valued. When we do for them what they're not able to do for themselves, they feel safe and comforted and protected. As we enable them to care for themselves when they're no longer with us, they feel increasingly capable and able to live a more independent existence when they are discharged from our facilities. And then above all, when we help them to maintain hope, maintain belief, they feel hopeful. And all of this together promotes their well-being. So how do we begin to translate caring theory into our everyday clinical practice? At UNC, these are the nursing interventions that we chose to ensure very deliberately that we were integrating the caring processes. Now, you may have different labels or slightly different definitions, but in all of our nursing interventions, they give us the opportunity to demonstrate these caring processes to our patients. I saw so much around intentional rounding when I toured the other day. And at each time we are involved in a patient's room with intentional rounding, it truly gives us the opportunity to focus and demonstrate each one of those caring processes, knowing them as an individual, where they are in their care, doing for them the things that they cannot do for themselves, being present and focused with them, and educating them as they begin to care for themselves. One of the things that I was so excited as I rounded on your facility is that I saw not only your frontline nurses are rounding, but I also saw that your nurse leaders are rounding as well. And together we're all validating that the care that we want to deliver to our patients is happening every day. Another aspect of rounding that we added at UNC was, you can't provide an excellent patient experience without nursing, but it also takes much more than nursing. So we integrated with our support partners. So our managers of nutrition and food service and housekeeping also rounded with our managers on our patients so that we get a collective sense of knowing and how we're doing on the care of our patients so that we're delivering an exceptional experience. Healthcare is complex, and explaining it to our patients can be very challenging. And so we've adopted this approach of words and ways that work. And there are very specific things that we need to communicate to our patients when they're admitted or discharged or going to surgery or returning. But we always want to make sure that our communication is authentic and that it is there are many times it's more than the words, it's the ways that we interact with our patients. A caring touch, being creative in the way that we communicate. And I know that you're doing that here, even using art and drawing. And as I was rounding, I saw how you've developed this tool to help your nurses who do not speak Arabic to be able to speak Arabic phonetically. And this is, I will tell you, the only Arabic that I can speak. But it is such a wonderful example of words and ways that work to help us to know our patients better. You're doing this so beautifully here. Narrating care is simply telling our patients what we're doing, why we're doing it, and while we're doing it. We want to care out loud so that our patients understand what's happening in each therapeutic treatment, and also that we have that opportunity to teach our patients while we're interacting with them and delivering care. And I think many people across the world know how compassionate nurses are as a profession. But I think as we narrate our care, we give them the opportunity to also see how incredibly smart and intelligent you are and how complex your job is as you integrate so many various aspects of care to deliver the very best in care. No passing zone. When you think about it, when a patient uses their call light, what they're telling you is, I need you to come be with me. They're looking for that caring process of being with. It may be physical assistance, it may be emotional support, it may be questions that need to be answered. But as we each take the responsibility of being a first responder to every time a call light goes off, our patients see our commitment to responsiveness and to being with them. And that is how we integrate that element into our clinical practice. Moments of caring. Every time we have an interaction with our patient, there's always should be a moment of caring. But one of the things that we found very valuable was expecting our nurses once each shift for 3 to 5 minutes to pull up a chair and sit by the side of their patient and to speak with them about whatever is important for them for that day. It may be the conversation that's sparked by a photo of family or a significant place that's in the room. It may be that they're concerned about the surgical procedure or their treatment and they want to have that opportunity to discuss that with you. Or it may be just the disappointment that they feel because this is the second time that they've been hospitalized and missed a family gathering. All these are ways that we can connect with our patients in moments of caring to show that we want to know them, that we're committed to being with them, and to help them to maintain belief while they're struggling with this clinical condition and their illness. Patient-engaged bedside report. I was so glad to hear that you are committed to this. I'm ashamed to tell you, but I'm going to be really honest. When I was a young nurse, change of shift report happened in the break room with coffee, donuts, and a tape recorder. There wasn't even another nurse in the room, much less the patient. But as you do patient-engaged bedside report and you commit to that, what you're really doing is bringing the whole team together, able to demonstrate each one of the caring processes as you work to know that patient better, as you're together with them as a team, as you do for them and enable them to participate in their own care. It becomes a very powerful way of communicating caring to our patients. Each one of these nursing practice interventions are linked to one of the Swanson caring processes. And I suspect if you have other specific interventions in your organization, you can take a moment and look and see which caring processes do we have the opportunity to communicate more effectively to our patients as we interact and care for them during each of our nursing interventions. So how do we know how well we're doing as we try to communicate caring? In the United States, the Centers for Medicare and Medicaid require that we use the HCAP survey. And each HCAP survey has a very specific list of questions that one of the things that we've done is gone back and linked each one of those questions to the Swanson caring process. So that as we begin to talk about our patient experience scores, we begin to be able to translate that in to what is it telling us about the caring process? What is the voice of our patient in terms of telling us, you need to know me more. I need you to be more responsive and be with me. Or I didn't feel like I was ready to go home and take care of myself. And so I did a quick look because I know that you don't have to use HCAPs, but you use Press Ganey here. And so this is just a quick cursory alignment of some of those questions that your patients are asked relative to their experience in your hospital. And I think it can be a great opportunity to begin to talk with each other and to talk with our teams about what is the voice of our patient telling us around knowing and being with. Where do we have that opportunity?
Right. 2 minutes left, please.
I'll be finished just very quickly. And then doing for and enabling. That's our opportunity to make sure that we're preparing our patients to care for themselves. And that question overall of likelihood to recommend and overall rating of well-being is not something that you can individually work on an initiative. It's about how well we do all of our caring together to promote the well-being of our patient. And I know that's what you're focused on because as I toured, I saw well-being in your hospital's vision, that we're focused on well-being and our patients want more than the relief of suffering. They want to return to their maximum state of well-being. I'll say as I toured your facility in this hospital that's only been around for a short number of years relatively, it reminded me of this quote of Florence Nightingale. Never lose an opportunity of urging a practical beginning, however small, for it is wonderful how often in such matters the mustard seed germinates and roots itself. And that is certainly what's happened here at Almoosa. Thank you for allowing me to be a part of this conference and speak with you today.
Thank you very much. Thank you. All right. Thank you very much, Colin. Well, we shall move towards our last speaker, Dr. Andrew. She is the Chief Clinical and Innovation Officer at SA Healthcare, where she is a laser focused on preventing clinician burnout. She is recognized for her passion and ability to inspire, motivate, coach, and empower teams to advance the profession of nursing. Dr. Andrew led a large academic medical center to its first magnet designation and its first magnet designation. Also, Andrew has consulted with international leadership teams to inculturate nurse excellence and support magnet designation. Andrew is published and is an international speaker. She works collaboratively with patient advocates, physicians, and industry partners to create healthy work environment. Dr. Andrew will talk about compassion and purpose reimagine. Please welcome Dr. Andrew.
Hello, I'm Dr. Andrea Coyle, Chief Clinical and Innovation Officer at SE Healthcare, and I have a laser focus on clinician burnout and clinician well-being. I've been a nurse for almost 30 years, and prior to this role, I was the Professional Excellence and Magnet Program Director at a large academic medical center. I helped lead that organization to its first magnet designation and its first magnet redesignation. In addition, I've helped international hospitals start on their nursing excellence journey. I'm published, and I'm a board member of the Healthy Nurse, Healthy Nation. And I love being a nurse, and I'm thrilled to be with you today. I want to start off by expressing my sincere gratitude and deep admiration for Hera, Alik, Mr. Malik Almoosa. Your commitment and dedication to nurse excellence is a testament to your character, and I say shukran. I also want to thank you for putting this amazing conference together, because this conference helps all the participants create meaningful, magical moments and meaningful, magical connections. And speaking of meaningful, magical connections and relationships, a fun fact about Alik, she and I met 14 years ago in Phoenix, Arizona at a Nurse Excellence Conference. She and I immediately created this wonderful connection. And I'm so thrilled that she and I have been able to stay in contact. We pretty much see each other every year at the annual Magnet Conference. We connect on LinkedIn and just good old-fashioned texting. And so, Alik, I want to thank you. I appreciate you more than you ever know. No one, I promise you, was looking more forward to co-creating greatness with each of you over in Dumont. And I wish I could be there with you personally. It breaks my heart that I'm coming to you virtually, and I'd like to share with you, in the true spirit of Compassion Purpose Reimagined, why I'm unable to be with you in person. In December, I was diagnosed with breast cancer, and my amazing medical team has advised that it probably wasn't in my best interest to make the long journey over to Saudi Arabia, because I need to be rested and restored for my cancer treatment journey. So I thank each of you for your grace, and I thank each of you for the opportunity to come to you virtually. I also want to remind everyone to get your annual mammogram. My annual mammogram probably saved my life. If you're like me, you chose to get into nursing and healthcare because you're compassionate. You have great compassion for people, and you feel deeply compelled and motivated to relieve the suffering of others. And compassion in action sounds like and looks like kind words, listening without judgment, encouraging others, forgiveness, and offering a helping hand when needed. And there are other things that come along with compassion. Does that sound familiar? Now I have another question for you. Do you often overextend yourself, nurses? Do you put yourself second, third, maybe fourth? There comes a point as a nurse, healthcare provider, that you put someone else's interest in front of your own. And no matter how spent you are, guess what? Will overextend yourself. And this applies to parents as well. So as we reimagine compassion, let's reimagine putting self in front of compassion. Because it is very important to give yourself those same kind words that you give to others. That same hug that you give others, give yourself a hug. Give yourself grace. Quiet that inner critic. Quiet that. Love yourself. Believe in yourself. Show all of this to yourself the way you show it to the people that you serve, the people that you care for. Do you remember Dr. Jean Watson's relationship-based care model? Dr. Jean Watson's relationship-based care model has 3 relationships. It's the relationship with yourself, the relationship with your care team members, and the relationship with the patients and families that you serve. And all 3 of those relationships intersect. I haven't done the research, but I would venture to say that the most important relationship is that relationship with yourself. Because if you don't believe in yourself, and you don't love yourself, and you don't take care of yourself, and you're not kind and encouraging to yourself, it is hard to show up and give that to the patients and families that we serve. And it's hard to give that to the care team members that you collaborate with to deliver the care to the patients that we serve. And if we think compassion, purpose, reimagine, and we think about purpose, it is very difficult to find your purpose, find your why, find your assignment if you don't have that self-compassion for yourself. How many of you in this room know your purpose? My purpose became crystal clear to me in 2020 when I was furloughed from my role as the Professional Excellence in Magnet Program Director. And I did probably what most of you would do. I wanted to help people. So I took an assignment as an assistant director in a behavioral health hospital in a New York City suburb during the biggest first wave of COVID, in the epicenter of COVID. And I went up there because I wanted to help people. And during that time, I found out a lot about myself, about how important it is to take care of myself so that I can take care of others. There were so many uncertainties and unknowns during COVID. It was hard sometimes to put one foot in front of the other. But when I started to believe in myself and encourage myself and believe in myself, I found my purpose. I also found my purpose. I was asked to participate in an American Nurses Association, Healthy Nurse, Healthy Nation Twitter chat. And on that Twitter chat, I met Tina Brown, patient advocate, empathy trainer. And we immediately fell in love with each other. We share the same energy. And I found my purpose. The Twitter chat talked about gratitude. And I learned a lot about how important it is to be grateful for the people around you and for yourself. So if you are right now unclear of what your purpose is, I want to help you out. I want to help you find your why, help you find your purpose, help you recognize what your assignment is. Once you take a piece of paper and pencil, so hopefully you have that at your table in the room, and I want you to complete this sentence. Everything I do is to blank. You fill in the blank. So that blank. I'm going to say it again. Everything I do is to blank so that blank. Here's my purpose. Almost everything I do is to bring out the best in myself and others so that the world will be a little more kind and so that I can make a difference in some way for all the people in all the lives that I touch. Once you know your purpose, once you know your assignment, you will feel so meaningful. There will be such a why behind everything you do, and I promise you this will happen. I cannot wait each and every morning to put my 2 feet on the ground so I can go back at it and get to my assignment. So I challenge each of you to do that. And it might take you a month. You can play around with it. You can read it every single day and play around with it. Find your why. Find your purpose and get started on that assignment. And remember, compassion, purpose, reimagined. Reimagined, I'm going to make it really real for you right now. I'm experiencing reimagination by this conference. Almoosa Specialist Hospital and this conference is all about reimagination. Almoosa Specialist Hospital is reimagining healthcare delivery in Saudi Arabia. They're opening up new towers. They're doing amazing things in the kingdom. Congratulations, Mr. Almoosa. You're doing an amazing job. Almoosa Specialist Hospital is reimagining nurse excellence. Thank you, Maureen, Hera, Alik, Sherry. The nursing excellence standards are an amazing framework for transformation. So keep up the great work. Almoosa Specialist Hospital is reimagining meaningful recognition. Thank you, Mark. Thank you, Bonnie, for your incredible work on recognizing extraordinary nurses, extraordinary nurse leaders, extraordinary nurse teams. And Almoosa, if you haven't done this yet, get that daisy garden. Get a daisy garden, put that amazing statue in there. Nurses, go to that garden after you have it and reflect on your purpose. Thank you, Mark and Bonnie. Almoosa Specialist Hospital is reimagining people-first, human-centered leadership and care delivery. Almoosa clinical nurses, you are the heartbeat of every single hospital. Clinical nurses, you make the impossible possible. Keep on keeping on, Almoosa clinical nurses. Thank you. And that, my friends, requires compassion, self-compassion, and purpose. And with that, I say yet another shukran. Thank you for everything that each and every one of you do to advance the profession of nursing. And thank you for all that you do to serve people, because that's why we got into healthcare. And with that, I'm happy to take any questions.
Thank you very much.
Find your purpose.
Thank you.
Have
All right, I would like to call Colonel, please, Mr. Ray on the stage to start the panel discussion. Yeah, I would like to thank all of our keynote speakers, above, Mary, Dr. Andrea, and as well as Colonel Mr. Ray. So we'll start the panel discussion. If you have got any questions, we can answer them. The panel discussion. If you have got any questions, we can. Yeah, they are online. Answer them. The panel discussion. If you have got any questions, we can. Yeah, they are online. Answer them. The panel discussion. If you have got any questions, we can. Yeah, they are online. Answer them. Okay. The panel discussion. If you have got any questions, we can. Yeah, they are online. Answer them. Okay. The panel discussion. If you have got any questions, we can. They are online. Answer them. Okay. The panel discussion. If you have got any questions, we can. They are online. Answer them. Thank you very much. All right. We're open for questions. If you have any comments or questions that you would like to ask or add, we'll start with you, Dr. Dr. Jo.
My question, sorry, was for Professor Rafferty. Is she online?
Yeah, she's online. Yeah.
Professor Rafferty, can you hear me?
Yes, I can.
So firstly, as an ex-King's College nursing graduate, I am so sorry that you're not with us today. My name is Dr. John Sedgwick, Director of Nursing Education at King Faisal and Jeddah. And I just want to say thank you for all the work you've done over many years for nursing. I really have a comment, and I would appreciate your thoughts. The evidence that safe staffing is linked to patient outcomes is there, and it's been there for quite some time. Why are we still today trying to convince policymakers and those with the purse strings to invest in nursing? We know that there are incredible issues around supply and demand. So on one hand, we argue that we need more RNs in the workforce, yet actually the available number of RNs is not enough. What are your thoughts on that? Thanks.
Well, thank you for your question, and congratulations on being a graduate of King's College, and I'd love to connect with you afterwards, because, you know, we are very proud of our alumni, and I think we can see the leadership that you're giving is grounded in the education that you've received. Of course, I'm going to take credit for all of your wonderful achievements, but I think this is a brilliant question, and one which exercises and frustrates many of us who have been campaigning for better care and better staffing over many years. I mean, I was president of the Royal College of Nursing during the pandemic, by and large, and we were launching a safe staffing campaign. Then we have seen some movement on that through Scotland and Wales legislation and in the strike that we had in Northern Ireland, this is withdrawal of labour from as a major protest against really patient safety and staffing at that point, as well as pay. These disputes are never simple, into 2019. And that was successful in getting politicians from Northern Ireland around the table. They hadn't really been meeting beforehand. There'd been paralysis in the political process in Northern Ireland. So nursing was the catalyst that brought them together. And I think the answer to your question is that I think health ministers get it. I think education ministers get it. But it is the intransigence of the Treasury, sadly, that is very focused on, and, you know, I'm not an economist, you know, and that's why I was arguing for nurses being an asset. There is something about the mentality of the finance ministry, to people who are not familiar with our system, where they seem to want a quick return. And of course, what is difficult to quantify is the quick return from investment in staffing, because it is a long haul investment opportunity, and training takes quite a lot of time. But I think, I mean, even when you present, you know, the evidence of Jack Needleman and others, where small variations in target staffing levels, as we showed in that BMJ quality and safety paper as well, these actually have profound impacts on patient mortality, which is not a subtle outcome by any stretch of the imagination. So I am afraid at the end of the day, that's why we are out on strike. That is why we are using the ultimate weapon by withdrawing our labour and trying to manage that as safely as possible, to demonstrate that we are not, and it feeds into everything that the other speakers have said in the panel, that we are not prepared to sit back and just watch this catastrophe unfold in slow motion before our very eyes. We are taking action. We are standing up for patient safety. And if the future of our National Health Service, there's so much more at stake here than actually nurse staffing. But I think campaigning and political action is the only way to get this message through. And we probably have to even think of more creative ways of showing our desire to improve standards and our refusal to accept the types of settlements that, you know, a non-listening government is actually offering at the moment. I'm not going to go into the details of the dispute because we would be here for a very long time. But really, it's a very, very key question. And I think inflicting some kind of pain on a government and showing this point that I think was made, that I was making in the presentation, the public faith, public confidence in the National Health Service and public support for these strikes is high. Now, as soon as that goes, we are in a very different position, but at the moment the public are with us. And as I demonstrated in the presentation, patient satisfaction in nurse staffing is vitally important to ensure confidence in the National Health Service. And I think there are different ways of making that case. If the government does not accept that, they will lose the public faith in the National Health Service. And that there's evidence that that's already beginning to happen. So it's in the government's political interests to actually improve nurse staffing and job satisfaction for nurses. It's just cutting through to ministers who at the moment just don't want to listen. We are going to have to force them to listen. Thank you.
Thank you very much. Thank you. I had a follow-up question, if I could, Chair. One of the arguments is that so much of nursing remains implicit. And as nurses, we need to make explicit exactly what we do to policyholders, to various professional groups. So capitalising on the collective power
and the strength that nurses have collectively is critically important. And it's something that we cultivate into our new graduate nurses to be, let's say, politically aware, to be astute of what's happening in government, and to have a voice. And I think one of the challenges, I think, with the nursing profession historically is we've been a very divided profession. I think we need to come together and collectively share that vision, because trying to move forward with policymakers who have got the money when they don't understand the impact of nursing is a huge challenge, I think, in many different parts of the world. That's just a comment. So thank you again, and hopefully we'll get the chance to connect. Thank you.
Look forward to it. Thank you.
I would like to just make one follow-up comment. In the military, when I was in the Air Force, one of the things that we did to help nurses have more influence on our Congress was creating congressional fellowship opportunities. And that can be something to consider in terms of where institutions might even have the opportunity to create some sort of parliament fellowship, but that is, it's unique learning to talk to the government. For somebody who's been in there for 26 years, it takes a certain skill set. And so I think giving our nurses opportunity to be able to learn through fellowships that interact with government policymakers is a great way to long-term increase our influence.
Yep, thank you very much. We are open. Yeah, go ahead, please.
Andrea there? Is Andrea there?
Yes. Hey, Hera, I'm here.
Hey, Andrea. You just said much more than what we deserve. Thank you so much for all your words of motivation, inspiration, caring, compassion. We just want you to get better and come and see us very soon. Okay, Andrea?
Thank you, Hera. I would love to come see you soon. And thank you for this amazing conference.
And Marie, I just want to show you off to all my staff. Do you know that she's my PhD study supervisor? So, if you do your graduate degrees and then move on to your PhD degrees, you get to meet wonderful people like her who inspire you, teach you, mentor you. I wish you were here. I love you forever, and I hope I'll see you soon. And don't give me a hard time on my studies, okay?
Well, you inspire me equally, and I learn so much from you and from students. They're a constant stimulus to me, and it's very much a mutual thing. So thank you, and I'm really sorry I couldn't be there. It's just terrible that things didn't work out timing wise. So anyway, next time for sure.
But I'm bringing your trophy with me next time I come to London.
All right. Thank you very much. And I would like to thank our keynote speakers, Prof. Reverty, Dr. Andrea, and Colonel Mr. Ray. Thank you very much. That was the end of the session. Thank you.
Thank you.
There's only one thing that makes a dream impossible to achieve: the fear of failure. Believe in yourself. You're braver than you think,
More talented than you know.
capable of more than you imagine.
So, go ahead, put a plan for your life, write down your goals, and go run for your opportunities. Grab all what you have, study them very well, and at the end of the day, be proud of what you achieved and be proud of your fulfillment. So this is my message to you after these 2 days, these inspiring talks and sharing experience from everyone. So take them, keep them in mind, and believe in yourself that you can do the same.
Our dearest Ms. Hera join us on the stage to give the closing remarks.
Oh my gosh, this brings us to the end. I cannot believe it. I just need a few minutes. Breathe in, breathe out. Well, what can I say? It's been an amazing couple of days. I just hope that you just take in everything that we have discussed and reflect on it, think about it, and try to, live it every single day in your practice, in your care, in your experiences. I just want to thank every single person who has been a big part of the organization of this conference and our wonderful speakers, moderators, guests. You have made an amazing ceremony, an event out of our conference, more than we ever imagined. Everyone, just to summarize these couple of days. So yesterday, we spoke about nursing excellence. We spoke about magnets. We spoke about how we have implemented and applied magnets in our region, in different hospitals. We spoke about Jordan. We spoke about the Saudi experience. We spoke about Lebanon experience. Then we moved on and we spoke about nurse leaders' role in advancing nursing and the transformation which is happening in the kingdom. We finished off yesterday with a Nurse Leaders Summit, which we are continuing. We will be having a summit too in Mawahib's conference coming up very soon. We had a wonderful night out. I'm just thinking. Our innovation hub, I hope you had a look, you had a visit, you looked at our simulation area and our booth and our posters. And then this morning, wow, the daisy ceremony. That was a wonderful, wonderful ceremony. So many stories, so many emotions. And then we talked about the students' experience, nursing education, transition to practice, the experience of PTAP in Saudi Arabia. Then we talked about nursing outcomes, nursing research, and we finished off with patient experience and nurses' wellness. So how to listen to our patients and how to listen to ourselves, right? So that's where we ended. So an amazing 2 days. I am very proud of every single one of you who've made it happen. Thank you for your contributions, for your presence, and we hope this is not going to be the first and the last. We hope that we will have more events. I can't promise we can do this every year, but maybe every few years. I don't know. Huh? We will? Okay. Well, thank you so much, and it's been a pleasure to have you all. Just thank you. Thank you.
It's our honor to start recognizing our amazing speakers who came from different countries, backgrounds, and culture. We'll start with the Queen of Magnets, Dr. Moraine Lal.
Dr. Julia Okwan.
Dr. Majida Rosay,
On behalf of Ms. Rosemary Paradise, Dr. Cheryl O'Connell.
our inspiration and our leader
and our queen
in the magnet journey, Ms.
Of
Alik
magnet.
Sorian.
My friend, my colleague, but I'm so proud of you, Ms. Nicole Dagher.
The President of Saudi Nurses Association, Dr. Muhammad Al Ghamdi, on behalf of him, Ms. Fatima Bulquman.
I don't think she's here. She's not around.
Yeah, we can proceed.
Dr. Fatima Al-Rifai.
Ms. Nada Masroudi.
Mr. Abdullah Gala. He's not here.
Dr. Abdullah Nagala is not here. Dr. Abdullah Nagala is not here, so we'll proceed. Our sweetest, Dr. Bonnie Barnes and Mr. Mark Barnes.
No, 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 no.
دكتورة إلهام العتيق.
Dr. Cheryl Cosme. The cutest.
Dr. John Sedgwick.
Dr. Abbas Almoosa.
Mr. Joel Ray.
Our beautiful CNS, Mrs. Kamar Younis.
Thank you so much.
Thank you. Thank you so much.
Would like to recognize our CNO, our amazing leader, Ms. Hera Tashijian.
Thank you.
We have a couple of organizers.
Well, I just want to surprise my little team now with a little surprise, with a little gift. So I just want to say a wonderful, like a big thank you for all the team who was behind the organization of this conference. We've been meeting weekly for the past how many months? And then in the past 2 weeks, we've been meeting every day. So they've been an amazing team to work with. I would like to give them a little gift. Miss Reem is not here. She's is Reem here? No? Okay. Maram. I'll Ophelia. We're all going to use this. You will find out what it is. Ali, one more time. Ahmad was the orchestrator of the whole innovation hub. Giselle. Okay, I think organizing committee, just get ready. Your name is gonna come up, so. Noor? Where is Noor? A wonderful workshop coming up in the afternoon. Okay, the three CNSs all together. Haraj, Victoria, and Kamal. They always come in three. I just want to make sure I don't miss anybody. Okay, Dr. Abbas. Okay, now let's go to our IT team. Dia, engineer Dia, is he here? He's not here. Well, Rahim, come on up. You take two gifts and Junaid. All right, let's go to Engineer Saad. Okay, Muhammad Nasrallah, Hamza Hassan, Amal Buraka. The three of you. All right, Rana Saade. Where is Rana? From the college, I really want to thank Dr. Salwa. And let's have the two students who also participated. Zoha and Sara. I want to make sure the names are correct. Yes. Okay, now let's go. Okay, now I'm gonna go to our marketing team. Firas, Mahjoub, Muhammad Salim, and my always inspiration, Nurhan. You see all these videos and all that. Thank you so much. I'm just gonna go very quickly to see if I missed anybody. I think I missed one more person. Lama. Lama Shanuha. Where is Lama? All these writings on the cups and everything, she's the person who put all the entertainment outside. Come on up. غنى العرب.
And now we will have our traditional dance in Saudi Arabia. So it will be performed now, right?
Ms. Tara, can you join us on the stage again? We're so sorry. Our superhero company.
True.
I don't want to forget our sponsors. They've been an amazing supporter, partners in making the Innovation Hub happening. We work so closely and so well with you on a day-to-day basis that sometimes we forget. So we want to appreciate you. So first, this goes to MediServe. No, okay. Dragger. Our amazing partners, Prometic. and last, Hilram.
بس خليني
And there are two people who've been taking our pictures all day long, yesterday and today. He's getting ready to take his own picture. Isa, تفضل. Now take the camera and Ala, come on. Ala.
Now just keep calm for 2 minutes. We'll have the cake cut. Okay.
I mentioned before that we will have our traditional dance. So now we will eat the cake first. We will cut the cake, celebrate, and then we will dance. Okay?
We'll have a special traditional Saudi dance. They will join us here, so just stay tuned and wait for them.
Okay.
The cake. Miss Hera, just please join us. All beloved speakers, you can just join us on the stage. شكرا لك. Organizing committee, please join us on the stage.
Uh, Uh, test. Thank you so much, everyone. I hope you enjoyed our national Saudi dance. Heading to the lunch, please.
Do not forget that we have our workshop. They will start at after the lunch. Enjoy your meal. Bye. workshop هيكونوا وين؟ second floor. We will be gathering here and then we will go to the workshop. Okay. you.